open the committee hearing, but firstly I just would like to put in an apology for the Chair, Ms Coker, and the Deputy Chair, Senator Kovacic. They will be here shortly, but they've just been held up at the airport, so they won't be too far away. I declare open this hearing of the Joint Standing Committee on the National Disability Insurance Scheme for the Committee's inquiry into the integrity of the NDIS. I begin by acknowledging the traditional custodians on the land on which we meet, the Gadigal people, and pay my respects to their elders past and present. I extend that respect to Aboriginal and Torres Strait Islanders peoples here today. We will be conducting today's hearing in person and via video conference. These are public proceedings being video streamed live with captions via the Parliament's website, and a Hansard transcript is being made. I welcome you all here today. I remind all witnesses that in giving evidence to the committee, they are protected by parliamentary privilege. It is unlawful for anyone to threaten or disadvantage a witness on account of evidence given to a committee, and such action may be treated by the Senate as a contempt. It is also a contempt to give false or misleading evidence. Witnesses also have a right to request to be heard in camera. If a witness objects to answering a question, they should state the ground upon which the objection is made, and the committee will determine whether it will insist on an answer, having regard to the ground which is claimed. If the committee determines to insist on an answer, a witness may request that the answer be given in camera. Could I please remind those providing evidence today that you should not divulge confidential, personal or identifying information when you speak. If you wish to supplement your evidence with written information, please forward it to the Secretariat after this hearing. The committee has taken steps to ensure today's hearing is accessible and is using Parliament's new interface video conferencing facilities to broadcast its proceedings. Any disruption to today's hearing from observers may prevent witnesses from giving their evidence to the committee and may negatively impact on the broadcast. Members of the public in the audience are therefore reminded to observe the committee's proceedings in silence. I would further like to advise that the media has requested permission to film and take photographs of the committee's proceedings, and the committee has agreed to this. I remind the media that this permission can be revoked at any time, and the media must follow the direction of Secretariat staff. If a witness objects to being filmed or photographed, the committee will consider this request. The media are reminded they cannot take images of members or witnesses' documents or of the audience. Media activity may not occur during suspension or after the adjournment of proceedings. I ask everyone to ensure they've switched off or turned their mobile phones to silent, and I remind committee members and witnesses who are appearing via video conference and who are not speaking to mute their microphones. If witnesses take any questions on notice, the committee requests that information be provided within 2 weeks by Friday, 29 May 2026. However, please liaise with the Secretariat if additional time is required. I now welcome Professor Jennifer Smith-Merry from the Centre for Disability Research and Policy at the University of Sydney. I understand that information on parliamentary privilege and the protection of witnesses giving evidence to parliamentary committees has been provided to you. For the Hansard record, will you please state your full name and the capacity on which you appear today?
I'm Jennifer Smith-Merry. I'm Professor of Health and Social Policy at the University of Sydney.
Would you like to make a short opening statement before I invite members of the committee to ask questions?
Yes, I would. Thank you. Our research, funded by my Australian Research Council Laureate Fellowship, is based on qualitative interviews with 86 NDIS participants, family members, and stakeholders across Australia. It examined experiences of the NDIS for people with psychosocial disability generally. While we did not directly ask about fraud or sharp practices, these issues emerged as a major theme across most interviews, despite not being prominent in the public discourse at the time compared to now. The evidence shows misuse occurs across a continuum, from routine non-compliance and poor quality or undelivered services to deliberate and criminal exploitation. These practices disproportionately affect participants with heightened vulnerability. Collectively, they undermine both NDIS participant outcomes and public trust in the scheme. We had been uncertain of how to present these findings. Although clearly significant, we were initially cautious about contributing to negative narratives about the scheme, participants, and providers. However, we welcome this inquiry and the opportunity to contribute our data. It is critical that public discussion of fraud focuses on practical actions government can take rather than fueling hysteria that risks undermining the scheme and unfairly blaming people with disability, who, as our research shows, are not responsible for these practices. We propose several recommendations for reform, some of which the government has already implemented or promised to implement. But I just want to highlight here our final recommendation, that integrity reforms are paired with clear, co-designed public messaging that emphasises participant protection and avoids blaming people with disability for others' exploitation.
Thank you. I might thank you for that evidence, Professor Smith-Merriam. I might just start with a couple of questions before I invite other members. The only privilege I'll ever get for being temporary chair.
And thank you, in my absence. Please go ahead and I'll...
Your submission states that fraud and financial misuse occurs along a continuum from low-level non-compliance to deliberate criminal exploitation. So are you able to provide the committee with some clarity about how you distinguish between the poor administration, negligence and intentional fraud in practice, and what indicators should trigger regulatory escalation?
I think that, okay, so I'll start with the second part of your question. I think that all aspects should trigger some sort of regulatory
action.
Reprisal, not reprisal, but, action. I think that it needs to sort of mirror the extent of the misuse. I think that I'll give you some examples of what takes place. So, for example, a family member makes a claim because they don't really understand the way that the scheme operates, and that's fair enough. Like, it's very difficult to understand how the scheme operates, and a lot of the descriptions of available supports are difficult to understand. So they might make a claim for something that is incorrect, but they do that in good faith. So that's an example of where you would need to rectify that situation, but not necessarily in a way that was going to be problematic for either the participant or the carer. Then you have situations where there's sort of ongoing behaviours of concern where people are, say, claiming for hours not provided. So continuous, and where it becomes a pattern. And that is something where you would need to, one, put in steps that are going to address that with the individual provider, but you would also want to look at regulatory mechanisms that are going to address that, such as digital time stamping, where people are coming into or out of a property, or coming into or out of a particular situation. So it needs to focus both on the regulatory mechanisms and for the system, but also addressing the problematic behaviour.
So, just with that, because that's, being able to consistently identify, when it's not just an accident or poor practice, but actual deliberate fraud. So when we need to be able to consistently identify that, and that seems to be a real issue at the moment. So how would we think about going about identifying false billing or even coercion?
So definitely there needs to be a larger group of people or part of the agency that is looking at these issues. So I think it's been an underdone part of the scheme from the start. It was a scheme where people had a lot of hope and people had a lot of trust in the scheme, and we sort of assumed that people were going to do the right thing. But actually the regulatory structures around it meant that was not going to happen, and it meant that there just weren't enough people to look at compliance issues from the start. So increasing the number of people in the agency that's able to do it, putting in place things like digital invoices and a digital payment system is a way where you can more easily track what's actually in the invoices. So you're able to digitally scan the invoices and then look at what's there and whether they match up with people's plans. I think also increasing the ability of and the capacity of plan providers, so people who are self-managing, increasing their capacity to be able to manage plans and understand the scheme in relation to their own plans, but also people who are running the plans on behalf of others. So they need to have some sort of training in terms of understanding what the scheme does, and a lot of people who maybe have family members who are managing plans don't necessarily have the financial or regulatory literacy to be able to manage those plans. Having plan managers that are much more regulated, so the commissioning of or the registration of plan managers, for example, is a significant issue that is going to be able to address that. So ensuring that plan managers have more training and more capacity to be able to look at that is important.
Just one more question, if I may. You mentioned, it's in your submission, but you also mentioned it in your opening statement that your evidence, some of your evidence is based on 86 qualitative interviews, but primarily focused on people with psychosocial disability. So are you confident that these findings are representative of a broader NDIS integrity issues across disability cohorts?
They probably point out, so I always find that problems with the NDIS are more acute everywhere for people with psychosocial disability. So if you want to know how to improve the scheme, you test it with the people with psychosocial disability, because they're the group that are more often not having their needs met. They're less likely to, for example, be able to access the scheme in the first place. They're less likely to be able to be trusted in their capacity to talk up about integrity issues as well. So I think that while I think problematic providers and problematic situations might be more likely to occur for that group because they have all sorts of heightened vulnerabilities, I think what it does is it draws attention to the issues in the scheme in a sort of a stark way that you might not get across all groups.
Yeah. Well, thank you, Chair.
I would just like to firstly thank you for your flexibility in planes are never on time, and so I've just come from Canberra, so I appreciate people's patience. What I'd like to do now is hand over to my fellow members. Di Lay, would you like to ask a question?
Thank you so much, Professor, and really appreciate you being here today. You talk about obviously we talk about fraud and abuse of the system. Were you able to identify which part has commit more of the fraud activities, whether it's in the plan, whether it's providers or participants? Was there any further analysis of where that happened?
So so ours is qualitative research, and it's actually very hard to get quantitative data on this, so this is why this qualitative research is really important. Having said that, so it's not we're not able to say, yes, it's definitely in this part or definitely in that part, but our analysis shows that people who are in situations where they don't have good advocates for them, so they're either not in a situation where they're with their families or they're Otherwise, maybe in more closed situations such as housing, supported housing, then they're more vulnerable to these. Also, if people have intersectional needs, so for example, they have cognitive disabilities as well, or they have drug and alcohol problems, or they have poverty, or so all of those things can add to people's vulnerability to the types of situations where really problematic behaviours occur. And particularly, I think housing, I'd like to point out, is an area where people, unless housing is provided by providers that have a very strong understanding of psychosocial needs, then people are often more likely to experience being vulnerable to fraud or sharp practices.
Just one further question. I had an NDIS local. I'm from Fowler, a very multicultural community, and my understanding from the minister answering to a question that I put him last week was that, or this week was that, it's about, while multicultural communities makes up about 30% of Australia's population, participants are about 90%. So it's really underrepresented. So as a result, I really wanted to gauge the multicultural participants, providers within the Fowler electorate. And what we were given an example last week that a clinical provider shared a case where their business was left $60,000 out of pocket because a plan manager had altered the provider's invoices to direct payments into their own bank account. So, with the work that you do, how, did you look at how those kind of situations can be improved so that a plan manager, don't alter the invoice, to a provider's invoice?
I'll just start with the sort of overarching issue there. So we talked to quite a few multicultural people from multicultural backgrounds as part of the research, and they talked about the real need to engage with community leaders and community groups that understood the person's situation in order to really explain the NDIS, because often what happens is that people who don't understand the NDIS, because it's difficult to understand in your first language, let alone a second language, is able to understand what they should be getting and be able to recognise it for themselves as the first sort of part of it. But it shouldn't all just be up to the individual themselves. So there should be, where those situations are referred, there should be actions by the NDIS Quality and Safeguards Commission that are going to address that, but also like a clawing back of those funds so that the person is not put out. Because actually sometimes people can find that they can't use their plans when these things have happened, and they are left out of pocket, and that's bad for people, because they're more open to exclusion and exploitation from the community, again because they're not being able to have the supports that they need in place.
Thank you. I'd like to actually ask a few questions before handing over to others. Can you succinctly, if you could, and thank you for being with us today and for your detailed submission as well, could you explain how fraud issues impact participants?
So I suppose there's a sort of existential and a personal impact. So people can feel, I suppose, the more existential one is about trust in the scheme and trust that the scheme is going to work in their best interest. So overall, a public discourse about fraud makes people, one, mistrust what they're getting from their providers, but it also mistrust of the government's ability to protect them through the agency. So that's problematic in terms of the overall discourse. Individually, people can, like I was saying in the previous question, they can have less on their plans that are, people's plans are in place to meet their needs. So the plans are meant to meet needs. So if you're not being able to get the supports that are listed in your plan because people are misusing that money or then you're not able to have your needs met, which means that you're not able to participate in society on an equal basis with others, which is the aim of the NDIS. So people can also find it difficult where plan managers or family members may have, or I don't want to say family members, but in our research actually there are examples of family members that misuse plans. People are then are out of pocket, so they can't utilise their funding.
Well, look, thank you. And I think that while there are a number of actions that have been taken by government, there are always more that we can do, which leads me on to discussing a recommendation that you've put forward relating to the operations of the NDIS Commission. Could you explain how you see the Commission currently, how it operates and how it could be improved?
Yes. So, in terms of the operation of the Commission, there were no positive statements in relation to the Commission in relation to addressing these problems. So, which was distressing because it's meant to be there for people who see fraud or problematic practices. But the people that we spoke to said that when they had gone to the Commission, if they either received nothing back or if they'd talked to the Commission, it was not a responsive process, or it was a process that was antagonistic.
So what would your recommendation be to improve?
So I think it would be around understanding that complaints handling is a really important part of the integrity of the scheme. So we need to develop across the scheme a culture of complaining, and that's not a bad thing. So we have it in the health system. So for the Healthcare Complaints Commission, for example, in New South Wales, we try to develop a culture of complaining because complaints are good. They improve the system. They shouldn't be seen as something that is problematic. But you need to be able to address the volume of complaints that are necessary for increasing the integrity of the scheme. So that's one aspect of it. The second is to have more of an oversight where you understand the areas where integrity is likely to be more of a problem, and for them to do more sort of own motion reports as they've done in the past, which focus on particular areas of concern such as closed settings or closed settings. There's not where people are in housing or where people are in situations of significant vulnerability. So I think it's balancing those things as part of it, but also but the reactiveness to the community as well is important.
Well, thank you. And my final question before handing over to Senator Stiljon is, of your recommendations, is there any you would single out as being the most important for the committee to consider?
I think, as I said in my opening statement, we are at a situation now in Australian society where the scheme is being undermined in terms of the public discourse. So we have a public discourse about fraud that is impacting very negatively on people with disability themselves and their own trust in the scheme, and the public's trust in this public asset that we have, which is the NDIS. So it's about how do we restore trust while addressing the issues of integrity. We have to do both of those things at the same time, and it's just really important that the government narrative is strong and is in dialogue with the disability community in a way where there's trust is being built.
Yes, because trust is so important, and I think the government in its steps has attempted to maintain that trust while strengthening the scheme, but there is obviously more work to do. So thank you. Over to Senator Stiljon.
Thank you, Chair. Thank you very much for your time, Professor. Could I ask you first of all, how could whistleblower protections be strengthened in the NDIS in order to better protect people who speak up?
So I think it's having a look at the way that I think we talk about in our submission that the way that whistleblowing protections have been strengthened under the aged care legislation to include a wider range of people that have protection under the Act. So expanding the definition of whistleblower, I think, is probably the first the first step in doing that, to ensure that people who speak up are actually adequately protected, because there's a vulnerability to backlash that comes where you are dependent on the services that you're provided. So people are less likely to speak up when they're dependent on housing or personal care from the people that you're speaking up against. So it's having those protections in place is really important.
And what are the gaps? We've recently passed some legislation to the Senate to address some of those gaps between the Aged Care Act and the NDIA Act. What remains to be done in your view?
It's difficult because they're actually completely different systems. So I don't think I'm in a position where I can compare them, because they're such different pieces of legislation and they're such different systems that they're acting upon. But I think in terms of how we address integrity, then the way that the NDIS Quality and Safeguards Commission is conceptualised within the system could borrow from other ways that we handle integrity.
Excellent. Okay, thank you. Now, we are talking today about fraud, and so while I've got you here, particularly with your expertise in psychosocial disabilities, I wanted to ask you, there's been a lot of media coverage overnight about changes to the definition of permanent disability. Is this a measure that you think would have a positive, would in any way help tackle fraud? And beyond that, have you got any other reflections on what the impact might be of these changes on people with psychosocial disability?
I think I would be concerned, so I haven't read the changes or the Act in full. I haven't had the opportunity to do that at the moment, but I am concerned about one particular change, and that is related to the need to exhaust all treatment before being able to, or exhaust all other avenues. Because what we've seen already in the operation of the NDIS, and we've done significant work on access and eligibility within the current rules, and the processes involved in that, is that people may be denied access, particularly under psychosocial disability, if they haven't tried all medical treatments to address their disability, and that can even include electroshock therapy or other types of therapies. Now, that conflicts with our state-based legislation, because under our state-based mental health legislation, you're allowed to not take up a treatment. So
You're allowed to refuse.
You're allowed to refuse treatment. That's a right that we have, that people have. So you can't. That would conflict with an NDIS eligibility criteria where you had to be able to show that you had tried all alternative.
Okay.
treatments.
So there's potentially a conflict between that kind of proposed change and the rights that patients have to refuse care under the mental health statutes in each state and territory.
Yes, that's right.
Okay, thank you.
I do apologise, but there are a number of people wanting to ask questions, so we will need to try and cut things a little short, unfortunately, so everyone gets that opportunity. I'd now like to hand over to Senator Mulholland online. Are you there, Senator?
I am. Thank you, Chair.
Go ahead.
And thank you very much, Professor, for your evidence. In reviewing your submission, you have a number of recommendations in the submission, and a couple of those have already been covered off on, so I won't go to those other items. But in particular, you made some recommendations around strengthening the regulation of conflicts of interest, including maintaining disclosure and restricting referral arrangements. And I did read with interest through your submission a couple of interesting points around some key takeaways that you had in there around family members not normally being allowed to be funded under plans unless there's exceptional circumstances, some issues to do with lack of qualifications for certain high-risk areas, and also some other areas around potential conflicts with friends and family. Would you be able to just talk through some of the top-line pieces of your research, particularly around conflicts of interest, what you found and why you are recommending further regulation in this area?
Absolutely. So we had a few examples of what we could call sort of cartel behaviours, and that's where someone may have a support coordinator or a worker that then refers to a support coordinator who then will only coordinate supports within a sort of a closed network of support providers. And particularly, so we had some examples where these are people with very large plans, so upwards of hundreds of thousands of dollars. So it can be a lot of money that comes into these sort of consortia or cartels where they hold a person within their control, I suppose, in terms of providers. And that is a real safeguarding issue, because people then, if all of your providers are within this, then it's very difficult for you to seek support outside of that is going to address poor practices or underservicing, particularly if you have heightened vulnerabilities or if you do not have personal advocates.
Thank you. So in your particular list of recommendations, you talk about introducing some disclosure requirements, and I was quite interested in our last hearing to hear that someone could be a plan manager or a support coordinator, but that didn't stop them from also being out in the marketplace offering services to those same participants that they are either supporting or managing their plan, as long as they disclose the conflict. But am I reading your submission correctly that perhaps is not strong enough as far as disclosing and regulating a conflict?
So some areas, yeah, you already have to disclose and regulate a conflict. So, for example, if I was a CEO of an organisation, it could be split into two, and I could offer housing, but I could also offer support coordination, and then I would have to manage that conflict. I think what we're not seeing is any regulation of personal relationships where it's going to be an impact. So, for example, if I was providing support coordination and my best friend was, I referred to my best friend who was going to offer housing or something like that. So there's nothing that regulates the plan managers or support coordinators for, doing that type of referral to friends that they know for mutual benefit.
Sure. And as you said, people are vulnerable, so they're going to be taking those recommendations pretty strongly and not really having the ways and means to go outside of that recommendation.
Yeah, that's right. And people don't necessarily have the understanding of the scheme to be able to question what's happening as well. So people might think that that is a normal thing to happen.
So you'd like to see some further regulation of particularly those close and personal relationships and people disclosing those and they're having to be very clear.
Yes, that's right.
Okay, thank you, Senator. I'm keeping everyone on a tight rein so everyone gets an opportunity to speak. I would now like to invite Mr. Pike to speak.
Thank you very much, Chair. Professor, one of your recommendations went to the concept of a national visibility of misconduct findings, which would be easily searchable. Could you talk me through how you would see that sort of working in practice, what that would look like, and also what problem that would solve in terms of how difficult is it currently for participants or their families or their plan managers to find whether an entity they might be dealing with is or has had a misconduct finding.
Currently, it's difficult to search for things that aren't really clearly classified as fraud, but when you do search the register, you can see providers come up, but it might actually mean nothing to you what's there. So in our submission, we have an example of the full content of one provider's notification on the system, and you can see there that the language used is unintelligible. Like, I couldn't even work out what this organisation had done, and so it's not presented in a way where you as the consumer of the service can say, oh well, if these people are legally able to practice still within the NDIS, but they have this condition, but it wasn't even clear what the condition is and how that might impact you as an individual. So one is about the intelligibility of the information that's on the system, and the second one is about how you search for that information. And I think the third one is, the difficulty with even knowing how to go about that search as well.
Yeah, well, that makes sense to me. And another recommendation talks about the Quality and Safeguards Commission needing to provide a bit more, I suppose, direct, proactive oversight, including targeted reviews of high-risk providers. And one of the examples you used in your submission was quite shocking, the one involving the locked door model. Matt, could you just unpack that a bit further for us as well? Like what level of proactive oversight are you actually seeing out there? And certainly the feedback I'm getting from my constituents is that there isn't a lot.
Yes.
Could you unpack that a bit further for us?
Yeah, so as I said in a previous response to a question, there were no people that talked in positive terms about the actions of the Quality and Safeguards Commission in relation to supporting fraud or integrity. And we directly asked about that, actually. So where people had mentioned a situation where we thought the Quality and Safeguards Commission might be involved as addressing that, we followed it up in interviews, and people were saying, oh, well, there's no point in going to them. They are not responsive. They have not been responsive to previous discussions we've had with them, or it's easier to go to the police or Fair Work or some other organisation because it's a more responsive process that's in place.
So that was the general theme you were seeing across the board in the system, that people just didn't have any transparency around where their complaints would actually head, or not getting any feedback.
Yes, that's right. No communication. Whereas I was talking before about a culture of complaining. Well, complaints, as they're managed by Healthcare Complaints Commission, there is a back and forth. So part of it is that you have to respond to someone within a certain time period. You have to make it clear what action you've taken, and there has to be a response that's provided. We are not seeing that in relation to the Quality and Safeguards Commission. And there's very little academic work that is currently looking at the Quality and Safeguards Commission as well. So we're not really seeing a lot of scrutiny from researchers. Our research is limited, as I said, to qualitative research based on these interviews. So that's a limitation to our findings.
No, thank you, Chair. That's all from me.
Okay, thank you very much. I'd like to hand over now to Senator Little.
Thank you. And thank you, Professor, for coming in. I've just got one question, and then I'm going to hand over to Maria, and that is, it's in relation to mandatory qualifications for high-paid roles like support coordinators. I'm interested to know how you see the lack of professional standards undermining the scheme's integrity, and would a mandatory registration for those roles reduce the risk of kickback or collusive practices or networks?
So what we've seen is that registration is not the safeguard that we would expect. So problematic behaviours happen for unregistered providers and registered providers. So you need to have a model of registration that is linked to an overall system of integrity. So you can't just say registration is the solution, and I think that some of the discussion has been around that. But I think that definitely for people with psychosocial disability, there's generally a need for providers to be able to understand the nature of that disability and to be able to work with people in a way where their needs and rights are being upheld. Because if providers don't have a training in psychosocial disability, then they take those stigmatising attitudes that a lot of the population has about mental health into the relationship that they have with clients. And they're not also, if you're doing support coordination, you're also maybe not increasing the ability of people to understand the scheme unless you're working with them in a way that makes sense in relation to their disability. Because part of the ensuring integrity is actually increasing the capacity of people with disability to understand what they should be getting and what they shouldn't be and what their rights are under the NDIS. And support coordinators have a key role in establishing those rights and working with people in terms of the capacity that they have, rather than just assuming based on, you know, what we might think about people with mental health or mental illness or disability.
All right, thank you.
Thank you, Professor. Thank you for being here with us today. 11 days ago, Minister Butler announced every NDIS participant will be reassessed from 2028. On the evidence in your study, what is the risk that a reassessment program that's pitched as an integrity measure actually ends up punishing the individuals that your research identifies as the victims of provider misconduct, rather than actually identifying and catching those perpetrators?
I mean, that's a difficult question to answer, but I think in terms of our work, mixing sort of this work with our work on access and eligibility, I think that there is a concern that the people that are doing the reassessments really will not understand, like, it's the same problem that I was talking about in relation to Senator Little's question, was that people who are doing the assessments really do not have the capacity to understand psychosocial disability and people's previous experiences of systems that might have added to trauma. I think also because people are often in unequal relationships with these providers, it can be problematic in terms of people not wanting to speak up about what they
Power
don't have.
imbalance. We've seen that from many of the submissions where they're afraid to speak up in case of retributions of some kind.
Yes, that's exactly right. And I think that the problem with assessments is where it looks at what people's planned spends have been and what they've got out of it, then that's that retrospective look that does not really understand a situation where people's capacities have been diminished by problematic providers, looking at people holistically rather than just, in a very sort of a checkbox way, is not really going to understand that they're...
It's not going to deliver the outcomes we're looking at based on the evidence or your research.
Yeah, so one of our big concerns about changes to access and eligibility is, that it's not going to be psychosocial informed. And the second one is that it's not really going to be able to understand people holistically. And to understand psychosocial disability, you really need to be able to look at people in the context of their lives, the broader context of their lives, because past access and eligibility processes have seen people with psychosocial disability, their access is well reduced compared to other groups. So 26%, for example, compared to 90% with other participants. And part of that is about the access and eligibility process, people's ability to get information, people's ability to be assessed in ways that really understand the context of their lives. So that access and eligibility piece, as I said before, you focus on psychosocial disability, you're more likely to get it right because you're focusing on the parts that we're more likely currently to get it wrong.
Thank you. A lot of the focus recently that we've heard is around fraud or integrity leakage or waste. What have you come across in your research within the system that you can see as the clear areas of susceptibility and the clear areas of opportunity to sort of, work on that and then obviously ensure that we have a system that is safe for participants?
I think it's, as I've said a couple of times, it's where people have heightened vulnerabilities because of intersectional needs. So Aboriginal and Torres Strait Islander populations, people who are in remote settings where there's not a lot of choice about providers, people who have languages other than English as their first language, and people with cognitive disabilities or other situations, people coming out of prisons, all of those situations where people are less likely to be able to speak up or recognise integrity breaches of the scheme. So I think one is about developing the capacity of people or working with the situations that we know people are more likely to be vulnerable in order to address scheme integrity.
Thank you. And on page 6 of your submission, you describe a carer's account of her brother in a 24/7 high-intensity supported independent living setting, and the fact that, it's called a locked door model, I think you referenced, and how she went there and he was literally locked in and there was no carer or no support worker, apologies. On the evidence of your study, how does a provider bill the Commonwealth for 24-hour care that nobody is physically there to deliver, and this goes on for some 14 months without anybody noticing that?
It's an absolute, it's an absolute breach of what we would expect in terms of the care for people in housing. We're currently undertaking a look in our research at housing that's provided under the NDIS in order to understand why we get. So another main theme that's come across our research is that we have housing that is provided for people with psychosocial disability that can meet their needs and is psychosocial oriented, but the vast majority of people are not getting housing supports that really address their psychosocial needs, and that puts them at risk. That situation is clearly just a breach, but that people with psychosocial disability often in those situations and unable to have the capacity or the advocates in place to be able to address those things. So housing is a really critical area of integrity reform that's needed. We have to have providers that, we have best practice models of psychosocial housing in Australia that are evaluated and costed, and we just do not mandate them within the NDIS. Having models in place that are by trusted providers that do follow those models, we're going to have more capacity to address integrity.
Yeah. And do you have any insight into, regardless of what kind of a provider it is, how we can have a period of 14 months where that actually occurs and there is no flag of any kind to the NDIA in relation to this occurring, or to the Quality and Safeguards Commissioner, or to whoever should be looking at this? And in my view, they should all be looking at it.
Well, I think there's a failure of systemic advocacy. So we don't have visitor programs, for example, to these organisations where we have them to other closed settings. So, for example, mental health inpatient settings or prisons, we have visitor programs. We don't, so that people are not routinely having advocates check on what is happening for them.
Yeah.
Advocates normally have to be a parent or a family member, but a lot of people with psychosocial disability do not have those connections outside of the support services that they're serving them. They're very isolated and they don't have people looking out for them.
One very quick one, if that's okay, Chair.
Yes, we'll have to be very quick.
Super quick.
Trying to keep us to
wonderful.
time.
One of your recommendations on page 16 is to direct the Quality and Safeguards Commission towards proactive oversight, which sort of leads me to where that last question was, including targeted reviews of high-risk provider types. In your research, in your view, are you able to tell me what a high-risk provider looks like to you? As briefly as you can.
Yeah, I think it's where individuals likely don't have so that there's a power dynamic in place where people are very dependent on the provider. And then they have these other conditions in place where they're unlikely to be able to advocate for themselves and they don't have advocates around them. And so it's those closed settings and other types of situations where they mimic those types of environments.
Thank you so much. Thank you, Chair.
Thank you. Thank you, Professor Smith-Mary, for your contribution today. If you have taken any questions on notice, the committee would request that information be provided within 2 weeks by Friday, May 29. There may be other information that you would like to submit as well, and you are able to liaise with the Secretariat if you require any further time. So on that note, thank you so much for being with us today.
Thank you very much.
I'd now like to welcome Mr. Mark Woodland from HISMET. Good morning, Mr. Woodland, and thank you so much for being with me today. I understand that information on parliamentary privilege and protection of witnesses giving evidence in parliamentary committees has been provided to you. For the Hansard record, could you please state your full name and the capacity in which you appear?
Mark Woodland, CEO of Kismet.
Thank you. Now, you're very welcome to make a short opening statement before I invite members to ask questions.
Thank you, and thanks for having me. My name's Mark Woodland, co-founder, CEO of Kismet. Kismet's a global digital marketplace and NDIS plan manager that supports tens of thousands of participants and processes hundreds of thousands of NDIS invoices every single month. When I left the Army in 2010, I planned to briefly work with my mum in her childcare centre before going back to study. But instead, I ended up founding a company called Explore, which is a childcare app that solves manual inefficiencies in the childcare space, paper sign in and out, fragmented records, and clunky payment systems. If you have children in childcare, there's a high likelihood you might use the Explore app, and I do apologise for my technology. But it now serves 2,500 people that work at Explore. I eventually sold Explore and now bought a farm for my family and a tractor and work on the farm. But when a family member that engaged with me for in-home care saw some of the same problems that I saw a decade ago in childcare, sort of forced me back into the technology space. So I started Kismet because I wanted to help and remove a lot of the administration burden in the NDIS. In care sectors, boring operational infrastructure is the difference between a system that works and then one that takes money, frustrates participants, and lets in bad actors. As an at-scale provider in the scheme, we believe we have an obligation to engage publicly and constructively with how the NDIS can work better. In a scheme with nearly 300,000 active providers, we were surprised that so few organisations publicly submitted to this inquiry, and the lack of engagement in itself is an integrity problem. The committee is rightly focused on fraud and non-compliance, but I'd really encourage the committee to view its integrity mandate quite expansively. A scheme with true integrity is one that delivers innovation, productivity, and better participant outcomes. And every dollar this inquiry can save from fraud is a dollar reinvested back into the scheme. And that really matters. But fraud savings are finite, and when the fraud stops, the savings stop. So the savings from increased productivity and innovation can compound year on year, and they're enduring. So research Kismet Commission found that productivity in the Australian care sector has gone backwards 5% over the past 20 years. Independent analysis by the E61 Institute using de-identified Kismet data found that more than 90% of claims for specialised services like occupational therapy and speech pathology were priced within 5% of the cap. Price caps aren't capping prices, they're really setting them.
Yeah.
And that's not a competitive market. Any recommendations for increased integrity measures by this committee needs to be matched with productivity measures. In our submission, we recommended mandating full API-based plan access for plan managers and standardisation of plan documentation. And this, in our view, the most important reform. Standardising plan templates and providing full plan access would create a single source of truth and enable genuine pre-payment assurance. Mandating standardised digital invoicing across the scheme, formally strengthening plan management as an integrity and insurance layer, and then publish scheme integrity metrics so the sector can benchmark itself and be held to account. Kismet would be delighted to provide invoice information to the NDIA, and we're keen to do so. Kismet has already built and deployed our own digital invoice and prepayment verification tools. The prepayment audit trail that many stakeholders describe as a future state exists today, and government doesn't have to build every part of it itself. Its role should be to set the standards, define the rules, and then enforce those rules.
Thank you. You'll need to wrap up.
I will certainly. I can wrap up right there.
Thank you.
And answer any questions.
All right. Look, thank you. It was quite informative. Before I hand over, I'll ask a couple of questions myself. Can you outline the patterns of concern you've identified in the NDIS payments and claiming. You've obviously done a lot of work in the areas of payments yourself in IT. What are your thoughts?
Yeah, we see a lot of manual processes is the best way to describe it. And then from those manual processes, significant amount of time spent on rectifying issues that come from manual processes. And one of those examples is making sure as simple as an ABN is accurate, or a business's name is correct on the invoice, or the bank details of a BSB or an account number are going to the right person. And so as soon as they're manual processes and being verified from a human, you introduce human error. Someone might have had a bad morning and it has read an 8 as a 7, and all of a sudden payment can get delayed or paid to the wrong bank account because those checks are not happening. You see a lot of delay happen for allied health providers that get paid on time, who are trying to pay wages to their allied health professionals, because these delays then just compound and compound. So what should be instant payment turns out to be 6 weeks.
Okay. So what would you suggest as changes in the payment system that could reduce the risk of fraud?
Yeah, so it's changing the way things are incentivised. So all we mean by that is you front load the requirements of payments. So as an example, KYC checks can be done before an allied health provider gets paid.
KYC?
So it's just a check to make sure that someone's bank details are accurate.
Good,
and you
thank
can do that. Sorry, I won't use any more acronyms.
Thank you.
So you're just checking to make sure someone's bank details are correct, that the BSB account number, that their bank details aren't fraudulent, and they haven't been swapping and changing bank accounts and things like that. You can front load that system. You can also front load registration, so people need to be registered. Other great technology that has come from the government is things like digital ID. You can require people to use digital ID, because then you know that they have been verified before they log into the system. So it's really just making sure people are incentivised to do the right things.
Yep, thank you. And then my final question is, could you explain how high quality plan managers can function as a layer of integrity in the scheme, and what would strengthen or undermine that role?
Yeah, we deeply believe that more requirements, more checks and balances on plan managers is a good thing. Making sure that they have the qualifications to deliver those services is a good thing.
Yeah.
Making sure that they can innovate and provide services for participants, allied health providers and families. The world I come from, you're incentivized to have the best product in the market at the cheapest prices, or people won't use it. That incentive doesn't exist in the NDIS because of caps and prices. Everyone's charged the same, and usually what will occur is people will find a provider or plan manager that's going to offer them a easier way for a payment to be processed, instead of a system that is incentivizing participants to get the best service.
So just to add on to that, so do you think that the plan manager panel, which has been discussed, do you think that would be of value?
I don't think it'd be a failure. I think transparency or a lack of transparency is where things fail, especially around auditing and requirements to get on that panel. I think the bigger challenge with that panel is going to be something along the lines of you have the same types of plan managers on that panel and nothing changes. You really need to incentivise, again, different types of plan managers that give participants true choice and control. So one might be technology-based, one might be service-based, but at least that's a choice compared to all service-based.
Okay, so you'd have a variety of different plan managers and who would participate?
Variety of different plan managers, variety of different sort of offerings that they provide, and it's a competitive market.
Right. Thank you very much, Mr. Woodland. Over to the Deputy Chair.
Thank you, Chair. Good morning, Mr. Woodland. Thank you for your time today. Has the Fraud Fusion Task Force, the NDIS Commission or the NDIA ever formally requested your anomaly data on any of the patterns visible in claiming, and that's around strange claims, fragmentation, billing at the highest price point?
Yeah, so with all of our data, so short answer is no, but we share it. We actively go out and say, would you like it? And how can we help? Especially, we've found...
Do you ever get any feedback from that?
Yeah, so we found the Fraud Fusion Task Force to be outstanding, really proactive, and they've done a good job, and especially with data. We'd love to do more.
Yeah.
We'd love to surface some of those breaches that they say and publicly surface it on our platform. So when a provider goes and a participant goes and finds a provider, they're getting that information in a very easy way to understand and make that decision. And we'd like to do the same thing and share that data back to government agencies so they're getting real-time information. We also anonymise all our data in what we call the care index, so people can see how their electorate is performing, and anyone can log into that and see what utilisation rates are and then try and improve that. So we believe in transparency, and data is a key part of that.
Yeah, and that seems to be a consistent message across a lot of different government systems, particularly where payments are involved. Is there sort of anywhere that you feel that you could provide more where you haven't been engaged, and where effectively intelligence on provider misconduct that could ensure that the system is more sustainable for participants is actually being left on the table because you're not being engaged?
The answer is yes. We're more than happy to share everything, obviously anonymised and data protected, but transparency is where you're going to get the benefits, and it's not just private sector saying we want more data. We need to make sure we can share that information back just as equally, which is where I think technology can play a role, and government has a huge part to play in this, which is building great APIs that allow people to access those systems and share the data back and forwards, so we get better outcomes for participants and can kick off some of the bad actors.
Thank you. I was quite interested in your comments around productivity measures, particularly around the standardisation piece. I'm very interested in deregulation and better regulation as opposed to more regulation. I see them as different things. Where I'm concerned, though, is whether this creates a one-size-fits-all model that doesn't particularly work, and whether that standardisation doesn't allow for particular nuances in somebody's needs and care requirements. How do you mitigate for that?
Yeah, so when we say automation and standardisation, there's always going to be those edge cases, which is why I think you're always going to need humans to provide those services for those people and for those allied health providers as well, where technology just can't do it. But that is sort of 10%.
Yeah.
The rest can be automated, and then the rest is generic enough to have a digital invoice that is doing all of the sort of checks before it gets to a plan manager. And then the plan manager can deal with those edge cases and provide the great service and customer service that the participant needs and gets the outcome.
So effectively, the vast majority is within that standardised window. You can put it through the system. It can effectively flow through freely, so that the caseworkers or those assessing can actually focus on those that are actually the edge cases, rather than spending time on something that is effectively a tick and flick. Is that your view?
That is exactly my view. It's the same thing we saw in education.
Yeah.
Educators spending more time with children instead of administration. I think that's what we all want, and it's the same thing in the NDIS.
Thank you. And I asked this question to the last witness, but are there any particular areas of fraud or leakages or waste, aside from those that we've just spoken about, that you've come across in the system that you think that we could focus on, as easy ways to take those out of the system?
Yeah, outside what I've already said, which I think is the lowest hanging fruit, which is the automation of and standardisation of just human error. I think there'll be far more efficiency from there, and then payment systems that can automate payments, automate claims without those errors, that's when they can start kicking. And then instant payments becomes a real thing, and that just helps the system. You can create or encourage more allied health providers that come on, which creates more supply and fixes some of those demand issues, especially in speech therapy and occupational therapy.
Do you I can see you looking at me. Would you say that the new PACE system is fit for purpose for what we're trying to do here? Do you think it has the capability to deliver, or do you think there are some issues there?
Again, simple answer is I think there's some issues there.
Yeah.
I think, again, when we try to do too much in technology and not just get the base layers right, which are great examples like single touch payroll, and then allow the private market to build on top of that, that's when things work. But when we just keep doing more because we get excited about being technologists, it doesn't work.
And that's your own, is it called PEPOL, your own system? Can that interface with it? Is that working?
Yes, correct. So we did that with the ATO or the Treasurers. They told us about that. So that's why the digital invoice was built to support them as well.
And it works fine for you?
Works fine, yeah.
Lovely. Thank you very much. Thank you, Chair.
Thank you, Deputy Chair. Over to Senator Mulholland, online.
Thank you, Chair. And thank you very much for joining us. For transparency, I have the Explore app on my phone for my son's daycare, so very familiar with your work. I'm conscious of time, so I'll just ask one question. The Minister for Health and Ageing and Disability made a number of reform announcements in the last few weeks. One of those was particularly around the mandatory digital system that all providers will now be enrolled in a digital payment system to allow the NDIA to have that visibility. I would be interested in your thoughts, obviously, given your extensive experience in this area, about what are some of the key things that the government needs to be looking at as we're forming up that payment system. I know your submission talks about making sure there's invoicing that matches up with plans, and there needs to be enough detail in that payment system that people are able to have that transparency. So I just welcome you to make some remarks based on your experience.
Yeah, it's a really good question. I usually use this analogy, so I apologise, but it's a bit like a sporting game. Governments, the umpire and the referees, their job's to make the rules and make sure they enforce them, and make sure, and then the players are the private market, and we're out there running around kicking the soccer ball. Part of that analogy is what to build is it's the government's role, my belief, is to make sure the fields are perfect and we're not running around falling into a pothole and the ball's going off and hitting someone in the crowd. So it's those APIs, it's the integration with government, it's making sure that payment layer does work, and that's not any fancy technology, it can be really done, and then allowing people to build on that. Provide innovation and different services for participants that, those core features might miss. So it's never about trying to build the entire ecosystem. It's about building sort of the pipes to allow others to innovate on top of that. So my only encouragement was, yes, we need a digital payment solution, but I would be taking that single touch payroll as a really good example of something that works. And works in the sense of private and government working together.
Okay. Thanks, Mr. Woodland. Thank you.
Thank you, Senator. Mr. Pike, online, over to you.
Thank you very much. I was going to touch on a similar theme to the last line of questioning, but I'm just I'm intrigued. We've had a budget laid down this week, which outlined a commitment for $358 million over 5 years to roll out the new enrolment and digital payment system. I'm just intrigued to find out from you as to whether, I've got no idea how much these things cost. I imagine you've got a better sense of it. But what sort of process do you think the government should go through to try to ensure that they get best practice? I know the government's done a lot of work on this in the past, back in when my party was in government, but I'm intrigued to get your sense as to what would be a best practice approach. And I also share Senator Mulholland's conflict that I am also a avid user of the Explore app, and can certainly see how you are a very knowledgeable participant in this space, and I'm intrigued to get your take on that.
350 million. I've personally never raised that amount in my lifetime to build companies that have been valued more than that. But this payment system doesn't need to cost that. And I understand there's processes and things like that. But Australia's got one of the greatest startup communities on the planet. And I don't say that just because I'm an Australian. I genuinely believe that we punch far above our weight and can deliver things that are exceptional. So building a platform, you could do it much cheaper if you tapped into those Australian entrepreneurs. And I reckon they'd do it for free. And I've got armies of engineers that could do it for free, just to make sure it's on record now. So, can do it for free.
I'm feeling for all your tech team.
Yeah, I was just going to say I'll talk to them later, but to help and to genuinely get a result that's going to support efficiency and productivity. Because it's beyond, what's in it for Mark or Kismet. It's if we can solve some of these things and make it more efficient, then we can provide services to more people that need it instead of capping it or locking it off. And then, families and people are struggling to get on that really need that help. I think that would be amazing. So it could be done much cheaper. It could be done for $0 if we tap the right people on the shoulder to deliver something for the community. And this is a community project.
Like to pay people for their services.
Well, I'm not advocating. I still stand by it. We can do it for free, just to get the outcome done. And
Solve the problem.
That's exactly right. Just solve the problem. But it's not going to take 5 years either. Now, this one's going to get me in trouble. You could do it in 6 months. It can be done much faster than 5 years, and it's just getting in there and getting it done. So yeah, let's see.
Well, that was going to be my next question. Whether what you thought of the time frame. We haven't got the full details of what the reforms will look like, but how long do you think it would take? If we had a dedicated team who was trying to build this up, and I realize it's difficult because you've got a system that's already operating and you're trying to invent a new system, but how long do you think it could take? And secondary, I'll add this, I'm conscious of time, but what would be, could you talk us through like a real world example of how a participant or a provider would be able, once this is set up, what would it loop like for them? How would it make their life different?
Yeah,
and how would it reduce fraud? It
shouldn't take longer than 12 months. And the reason for that is if anything's going to take 5 years, I don't think, and I certainly cannot predict the future, but AI in 5 years, we're going to have built a platform that is going to be replaced instantly, and it's just, I don't know what we're doing. So you must complete it in 12 months. Otherwise, don't do it at all because technology is going to outpace anything that we build in the first place. So in terms of what the system could look like is, if you have the right payment system and then you're allowing private companies to innovate on top of that, people could attend allied health providers frictionless by just arriving, service delivered, payment made, allied health provider paid as the person leaves, all the admin, all the checks, all the invoicing has already been submitted, and you're literally being paid instantly. That's not far-fetched, and that's not wild technology. You can get out of a car today, and you'll pay. You can order food online. You can check your dogs in doggy daycare, and all of a sudden the healthcare system seems to take 6 weeks to get an invoice paid. It doesn't make sense. So some of this stuff is real technology. What it could be in 5 years, I don't know. I think Elon Musk might be solving the problem with robots and things like that and flying cars. But what it could look like in 12 months would be quite exciting.
Excellent. That's all from me. Thank you very much.
Thank you, Mr. Pike. Can I just ask you, obviously the government's investing significant dollars, and really the amount the devil may be in the detail in terms of the amount of time it will take and the actual cost. But do you think that this is of value for the government to invest in this process?
I think it's a value for the government to invest in
And
product.
what will be the benefit?
Yeah, so productivity in the NDIS, and the benefit is reducing costs, the free up admin, which I think is the biggest cost, which creates fraud, which creates all these things we've spoken about. That's the benefit. And the benefit is more people could actually use the product, the NDIS, and get a benefit for their families. I think that's good.
And we'll look forward to talking to your tech team
Yeah.
about their
I'll let them know, yeah.
contribution. Thank you. Over to Ms Brown.
Thanks, Chair. I just have one question, just about your recommendation for a mandatory full API-based access to participants' plans. So what safeguards do you propose to ensure that participants' privacy, consent, and appropriate limits on access to sensitive personal information?
Yeah, you could make it completely optional. So if a participant doesn't want to opt in...
Isn't your recommendation around mandatory?
You can do it mandatory, you can do it optional. I mean, you would give people choice. We would prefer everyone is on it, because then it allows us to see things like goals and outcomes. It allows us to see the actual plan, and we can make decisions then based on what funding is useful, what funding is meant to go to where, without sort of having to guess. And that's where a lot of the challenges come from for approved invoices that shouldn't be approved.
I can understand where you're coming from in terms of seeing access as important, but when you formed this recommendation, did you have a look at around what safeguards there would need to be in place?
Yeah, so there's definitely safeguards that would have to be in place, and you could put things in like mandatory, not just registration for the NDIS, but mandatory registration into things like SOC 2, ISO, some of these other compliance tools that are a significant uplift for a lot of organisations that don't have this now, and they're handling data already that they don't have this type of qualification for, or this audit. And you could have a bunch of other things that are mandated as well. So something the childcare sector does very, very well is they send in people to assess the childcare centre. You can do the same thing for software providers. You can do the same thing for plan managers to make sure those sort of conditions are met. And if they're not met, they can be removed from the panel or taken down, whatever disciplinary action needs to occur. But these are sort of the rules that need to be enforced once they're set.
Okay, thank you, Mr. Woodland.
Thank you, Ms Brown. Senator Little.
Thank you, Mr. Woodland. I refer to page 2 of your submission because it talks about the disconnect between the plan and the invoice detail. I'm interested to understand what kind of standardisation you're thinking about, given that many participants standardise is not their life experience. How do you ensure that their specific needs are met when you're talking about standardisation?
Yeah, so when we talk about standardisation, we're talking about making sure that we understand the plan, that the plan is clear, the plan information is available, that when we pay a provider of whatever description, that information is there. So we're not asking the participant's plan to be standardised. That's not what we're talking about. We're asking about the administration that sits within that plan to be standardised. So those processes can be sped up instead of people having to wait long periods of time. And it goes back to my previous point, is some of those plans won't fit in that bucket. And that's absolutely fine, which is why then the service, or you'll always have a human service, can be offered based on whatever the participant needs are. So it's never about wiping out humans completely or wiping out customization or choice. It's really, how do you standardize all of the admin and the pain that sits around and takes away from outcomes, takes away from efficiency, and it's not just the participant that's impacted by a lack of standardisation, it's the allied health provider, it's the family trying to decipher how to interpret the plan and get the services they need, and the different codes and the way they can spend that money and the stress that is put on people if they get audited and they haven't followed the rules unintentionally.
So we've just seen an example of where there hasn't been the capability to intervene in a system based on an individual assessment of a person's need. At what point then in that system do you see that that could be possible?
Sorry, do you mind just repeating that?
So, hear me, I'm trying to understand,
Yeah.
if you're talking about essentially a system, I'm interested to know where the ability is for somebody to intervene in a system where we're still talking about standardisation.
Yep.
The computer has to understand from somewhere what it's referring to.
Yeah, so this is a good point, because you don't want to have a system that is changing someone's plan, or making a decision about someone's plan, changing funding, or doing those types of recommendations. That will, what my opinion is, that should always be done by a human, and the system is prompting based on this is what's happened. Overspending's occurred here, it might need a review to do this. It's not automatically approving a plan to change. So I think that is absolutely critical, and it goes back to my point, is why you always need human intervention. The challenge you've got now is a lot of those things will just fall through the cracks, and there's not even an alert, there's not even a notification that these things are happening. It's someone might check it, or someone makes a complaint, and then it happens. So it's always what I was talking about before, it's never front-loaded, we're always reacting to a problem and not being proactive towards it. So I definitely don't recommend automation in the sense that there's no human input.
So just on that theme of technology, consistency and digital efficiency, I'm interested to understand that kind of makes more reference to the system that's used by the funding provider, in this case a government. What about the cost of people who are providers or that have to interact with their system? Have you done any work at all around what resources, what services, what technology is going to be required by people who are delivering a service in order to be able to use a system?
And so this is the best thing about sort of the rails and the rules being set, because I deeply believe that's the private company's job to reduce that friction and innovate in ways. So as an example, the last thing we would want is to make the speech therapist in this example have to do all this extra work and have to do all these things, because that's friction, that's not helping. So it's our job to solve, how does someone just attend, get paid, and everyone walks away happily? That's something that we have to innovate and fix, and we think there's solutions that you can do that. So I would be pushing back deeply against a requirement that everyone has to, it's on them to upgrade their systems, it's on them to do this, where technology should be supporting that by the person pitching that idea.
Okay, thank you.
Thank you, Senator Little. Thank you for your patience, Senator Steele John.
Thank you. Thanks, Chair. Mr. Woodland, listening to some of your claims here this morning, I'm tempted, in the more caustic part of myself, to ask you whether I can buy some snake oil from you while you're here with the committee, but I will restrain myself from that because what you've put to us in your submission is alarming, I've got to say, quite frankly. Section 4.5, which I think Senator Brown was referring to, talking about your recommendation that there is mandated full access to plan documentations and the standardisation of that structure. What exact information would you like the Commonwealth to transfer on a mandatory basis into the hands of a private organisation?
Yeah, we want to see and make sure that when we deliver a service, be it plan management in this case, we want to make sure that we can see the goals and outcomes and support and make sure we're delivering that service as well. So making sure that the participant's getting those goals and outcomes, and the allied health provider in this example is delivering those outcomes. So when we pay an invoice, we can say, hand on heart, yep, that invoice is achieving this result. And so when we get asked the question of why did you pay that invoice, we can say for these reasons. And that data definitely helps with that.
So, but to drill down to some actual specifics, what information about individuals, their medical information, their disability support needs?
Yep, don't need any of that. What we need is the plan details. So we don't need information about their medical history. The plan details is really the key one, is those goals and outcomes.
So if you've looked at a plan,
yep,
you'd know that what you've asked for in your submission, so funding periods, budget balances, stated goals, description of funded supports, consumables, all of those speak to medical information. You understand that?
Yes, I understand that. But it's in the sense of making sure we can provide those invoices and service. We ask for those things so we can automate administration, and we want to make sure we can do it efficiently. It's got nothing to do with we want information for the sake of information. It's so we can deliver that service, and when we get asked to justify why we delivered that service, we can say for these reasons.
But you'd have that information in your possession.
Yes.
The private entity.
Yes.
So what privacy safeguards are you suggesting to protect that information?
Yeah, we're suggesting all of those ones that I mentioned before.
One of them was opt-out, so that's not a great start.
Sorry, which one was opt-out?
Well, you said, literally the first thing you said to Senator Brown was, well, they could refuse.
Yeah, well, sorry. But what I suggested after that was things like SOC 2, ISO, checks done by government that come in and have a look at those services like we do in other organisations. We would encourage a lot of regulation if that was the path that was chosen and enforced. And that would create more safeguarding across the sector, because right now none of that happens. So we see it as a better option, and if it's not met, then that data is not shared, and then those providers will have to figure out how they provide those services or not. It goes down again to that comment about if I thought the panel was a good idea. It's just about transparency. So if those rules are allowed and you can get access to this data, it's how are you managing those data and what are the safeguards put in place? I would argue whatever the government has said that these are the safeguards and this is what's required, that's on the plan managers to live that, or run the risk of being removed from the panel or losing customers or a series of other consequences that come from that. So whatever the rules are, we could make them super strict, but that's completely up to the rules that are going to be made.
Yeah, but you only get held to account for breaching those rules once the breach has occurred. So
Yeah.
you've already got our personal information, you've already lost it, sold it, been hacked, all things that have actually happened when governments have engaged in these kind of partnerships with the private sector. And then you get, a rap on the wrist, a little fine, but our data's out there. And I don't think you understand the personal nature of what is involved in asking for somebody's goals, their broad plan inclusions, which can go to a very personal level of somebody's supports, the consumables, and you do this in a structure where you say the ideal state is a structured API-enabled automated compliance process with checks at the point of claim.
Yep.
That's some of the most personal information that you could possibly have in the possession of a private entity.
Yeah. And I completely agree. There's lots of incidences where it hasn't gone well.
Yeah.
I completely agree. I don't disagree at all.
Yeah.
I think what we need to balance is what efficiencies and productivity do we want to achieve from the scheme, and then what do we need to put in place to make sure a lot of these things that you've mentioned don't happen. And I think that's the huge opportunity that we do have to be able to set those benchmarks and put those robust rules in, but we're also living in a world where, we can put 1,000 rules in, and quantum computing might change all of those rules again. It goes back to my point before about AI. Like, we can solve for today and make it super robust and strong, but we're going to have to keep solving for it. It's never going to be perfect. And I get the problem with personal data. I deeply do. And I'm not taking it lightly. And I don't think you should be selling it and using it and using it to gain at all. It needs to be very, very strict and controlled to make sure the outcome is the result and it's the best thing for the participant. One, for sort of choice and control, but making sure payments are made faster.
Thank you very much. And Ms. Lee, I would like to thank you for your patience today. Over to you.
Chair. Thank you, Mr. Woodland. I'm a member representing Fowler, a very multicultural community, and I just had a quick look at your website, and I noticed that quite a lot of providers are from my electorate on your website, and which is great. I've got quite a few questions. I suppose I'm an early adopter of technology, so I think I get so much around technology and the changes in technology very quickly as well. So what, as you said, we might have something very robust now, but then technology and AI will kind of surpass that, and then we have to constantly change. How do you've got 150,000 providers and participants on your site. How do you select these to be on your, for instance, on your platform? And is there a a membership, or how do they get onto your platform? And how do you assess their quality as provider to be using your platform? That's a start. I'll just give it to you all at once, so that way you can answer. So I had last week, a quick kind of brought together about 20 providers. That's just a very quick gathering in my electorate. And one example, a plan manager provided that there was another plan manager, altered the provider's invoices, and which left the clinical provider like $60,000 out of pocket. So this resulted in the provider being accused by the participant for payment, while the plan manager continued to intercept the funds for 6 months. So in a case like that, how would your platform could it intercept? And what are your thoughts around the qualifications, the expertise and experience to be a plan provider, other than, say, being a numbers person, accountant, etc.? Sorry, there's a lot a lot there. I hope you were able to.
Thank you. I'm trying to answer all of it. So the platform is free, so anyone can sign up to use it. And sorry, I'm answering your first questions. In terms of verification, there's a few things that happen. So some of the things that we do to surface as much information for people so they can make an informed decision instead of having to search all of the internet to get it, is we will go out and we call it scraping. So we'll go and get all the Google reviews, Facebook reviews, all the reviews on an allied health provider, and we'll put that on there. So when someone goes and looks at it, they're not just seeing reviews left on our website, they're seeing from all around the place. So they can make a decision. The other things we're doing as part of that verification check is checking ABNs, how long that business has been operating for. Not always a red flag, but if it's a recent business that's just popped up overnight, we'll highlight that. How long the website's been up, have they had it running for a long time, short time, all these types of things we're trying to just surface as much as we can. And then to become verified on the platform, so you'll get a little tick, we physically call you to make sure you're a registered provider, or a real human at least. So I think that answers those questions. I hope it does, and if I haven't, please tell me. And then the second question was around catching invoices and manipulation of invoices. This is my whole argument about standardization and enforcing rules and regulation that these providers, including us, have to live by, with real consequences, not just a slap on the wrist, like significant consequences, which I do think that they're in there, that the director of these plan management businesses is responsible personally to pay these things back. But technology catches that. As a good example, when someone changes bank account details, the system flags it. And that might not sound like much, but what happens a lot is people change bank account details to start moving funds around, and so that gets flagged. Things like when you transfer money from bank account to bank account, you'll see that the names and the account numbers and BSB matches, so that matches. So a lot of these things would be flagged in something like that. But, our hope by reducing administration is, the support coordinator in this example, I know they're not part of your example, but they would be in this example because they would have more time to go talk to the participant, engage with them, and this would have been surfaced sooner. So it's not about just getting rid of people all the time. It's about how do you surface some of these challenges so people can intervene.
Just last one. You talk about ABN. Obviously, what I've heard as well from my consultation is that there's a lot of phoenixing, and so they will set up a company and they shut and they'll emerge at the same. So would that your technology be able to catch that, and how do you think we can improve that in order for companies that are setting up as opposed to serve NDIS participants aren't emerging as another somebody that's ripping off the system?
I mean, we'd love to work more and more with things like the Fraud Fusion Task Force, and this is the API conversation, is being asked for us to be able to share that information straight away. So if these alerts are happening often on this sort of flag provider, can we share that quickly in the moment, in real time, so the Fraud Fusion Task Force isn't doing it reactively? I think that would be incredibly powerful. Basic technology picks that up already. So flagging, constant changing of bank accounts, constant changing of ABNs, constant changing of names, all this stuff is always flagged. And visually the invoice goes red, or different areas go red, and then that's the prompt for the human to start engaging of, hang on, this is being picked up, it's constantly being picked up, what's going on.
Do you think the government needs to do something more around phoenixing? I mean, your technology flags that, but I think obviously it's still happening. Obviously it's happening now in the NDIS. It has happened in the renewable sector a lot, and it's now kind of seems like it's moving into the NDIS. Is there something that should be done in order to really clamp down on that?
I would argue live transfer of data in real time, so people can literally be knocking at the doors as it's happening, as evidence, and start enforcing some of this stuff. I just think it's all too reactive, and by the time you've found out, it's months and months before anything can be done. And they've done it multiple times since then, and just racking up bigger bills, and most recently sort of buckets of money and gold in buckets that were found. So yeah.
Thank you.
I might leave it there. Thank you very much for your questions. Thank you, Mr. Woodland, for your really quite constructive responses. We appreciate it. It will all help us with our recommendations for this inquiry. If you have taken any questions on notice, the committee requests that information be provided within 2 weeks by the 29th of May. However, if you need more time, please get in touch with the Secretariat. So thank you once again for your attendance. We will now suspend and return at 12:45 p.m. Thank you. Welcome representatives from Self-Manager Hub. I understand that information on parliamentary privilege and the protection of witnesses giving evidence to parliamentary committees has been provided to you. For the Hansard record, if you could please state your full names and the capacity in which you appear today.
Samantha Payor, I am a co-founder and board member of the Self-Manager Hub.
Thank you.
I am Meredith Coote. I am the Secretary of the Self-Manager Hub.
Thank you. So before we begin, would you like to make... Oh, and there is a third person online. My apologies. Would you like to introduce yourself?
Good afternoon. My name is Karen Shine and I'm an NDIS participant.
Great. Well, thank you very much, Ms Shine, for being with us today. We're looking forward to the discussion ahead. Before we begin, would you like to give a brief statement?
We would like to do that. Thank you very much.
Go ahead.
Okay. Thank you, the committee. Just a brief overview. The Self-Manager Hub is a peer-led organisation. We have around 16,000 members with a very active online community. They are all NDIS participants and nominees who self or plan manage, and many of them directly employ or engage their own workers. And our submission drew on a survey that collected a smaller number of people in April, just last month. Personally, I co-founded the Self-Manager Hub, but I'm also a self-manager for my two sons with disability, one with Down syndrome and autism, the other who has a brain injury. The life that we've built for and with them hinges entirely on the flexibility of those funds. And on my own conservative estimate, the way that we self-manage saves the scheme around $300,000 a year compared with delivering a lesser support through traditional providers. I believe Meredith's in a similar position. We're not speaking today from a distance. This is our life and the lives of the people we love. Also, for disclosure purposes, I did want to let you know that I have a support coordination business and participant training, a for-profit, for-purpose business with a team of around 30 disabled people and carers, serving around 400 participants around Australia. And I've been a member of the NDIA's Independent Advisory Council for 5.5 years, but I am here in my personal capacity and my volunteer role as part of the Self-Manager Hub. Regardless, I live, eat and breathe the NDIS 24/7.
Right, thank you.
I would like to stress that the Self-Manager Hub deeply agrees with the premise of this inquiry.
Yes.
Scheme integrity matters. Yeah. Every dollar lost to fraud or poor practice is a dollar that doesn't reach somebody who actually needs it. And it seriously dents the trust of the general public. Our members care about that. But our genuine fear is that the scheme is throwing out the baby with the bathwater. Self-management done by the disabled person or family self-directing their own supports is where some of the scheme's best innovations, real cost savings, and actually its strongest fraud protections come from. The quality of life it delivers is life-changing, and what's missing in much of this discussion is the quality and the outcomes that the scheme deliver. The current direction of integrity policy is putting this at risk. The scheme needs to be clear-eyed about who it is targeting. There is a world of difference between a self-manager, a disabled person or a nominee who loves them, and a non-disabled bad actor rorting the scheme or a provider taking the taxpayer for a ride. They're not the same problem, but integrity at the agency seems to treat everybody in the same way. The self-manager acting in good faith is delivering the outcomes that are so desperately needed for the scheme, and we're the ones who appear to be carrying those consequences right now. Our core message is that self-management is not an integrity risk to be managed out. With the right guardrails and supports, it's the opposite. It's an integrity safeguard that's already working. And current and proposed settings are weakening that special, not secret, source.
Thank you. And the self-managed is at this stage, as far as I'm aware, is that there isn't a threat to self-management of plans.
The way that the integrity team at the agency are currently acting
Yeah.
is putting at great threat to self-management, and what we are seeing happening on the ground with self-management being taken away from participants for, at the very least, spurious reasons is significant.
To that, thank you.
Thank
Did you want to add anything to that?
I did, and also Karen wanted to add her own experience.
Yes, if we can just keep the intro short.
Absolutely.
Because we do have a number of committee members who are very keen to have a discussion.
Absolutely. So as Sam said, I'm not speaking from a distance. I care for a young adult with psychosocial disability and I self-manage their supports. So as Sam said, self-managers, their nominees and carers, we reconcile every support against lived reality, and we know whether a worker turned up, whether the hours are real, whether the services are good, what the goals were, and if the support actually moved towards supporting those outcomes. And I think that's the critical factor. And the problem is that integrity responses are too often aimed at us instead of provider billing. 40% of our respondents in the survey that you have before you said it had been who had been through a difficult audit or payment review said that they were guilty until proven innocent. One member told us an auditor said, if you can't manage it, we'll simply make you NDIA managed. I think that's a great time for Karen to talk and share about her experience. So thank you, Karen.
Over to you, Karen.
Thank you. Thank you for the opportunity to speak today. My name is Karen Shine, and I'm an NDIS participant who was subjected to a prolonged, procedurally unfair scheme integrity audit that resulted in a $21,000 debt with just 14 days to pay. 18 months later, that debt was withdrawn with no restoration of my rights. What I share today is only a snippet of the ongoing and stressful experience which highlights systemic issues in the capability and culture across the NDIA. So how did all this begin? The ordeal began with a simple, honest data entry error when I entered an incorrect date for a therapy claim. During that conversation, the planner noticed that I had my own ABN on one of the other invoices. Promptly said to me, "Participants aren't allowed ABNs. You can't directly employ your support worker." I was sternly told that having an ABN was profiting from my plan, was fraud, and that I should simply just ignore tax and employment law and just do what the NDIA requires. I was then referred to scheme integrity. My experience was not aligned with the NDIA's publicly promised educative compliance process. The NDIA website actually says, "We understand that mistakes happen. Our compliance activities are designed to be supportive and educative." My experience was quite the opposite. It was adversarial, accusatory, and punitive. I was audited against rules that didn't even exist at the time I made the claim. I was told I should have claimed using categories on the self-managed portal that don't even exist. The NDIA assumed fraud and raised debts whenever 2 or more suppliers invoiced for the same period. That's not evidence of fraud. That's evidence of my choice and control. The audit escalated into investigating issues far below any reasonable threshold. For example, the audit stated, "This is a reasonable purchase based on her disability. However, the participant has purchased 3 drinking aids in 2 different colours. This is an unnecessary duplication by 1 drinking aid, and a debt of $11 will be raised." I was told it was misuse to buy low-cost smart home automation. I was told my minor children could be reasonably expected to turn my lights off at 11 p.m. The NDA also ignored its own assistive technology policy. I purchased positioning supports from a mainstream store, in-store with my occupational therapist. This saved the scheme thousands, yet it was deemed misuse and a debt was raised. The list of misuse and fraud claims continued in this preposterous fashion, calling into question 50% of my overall core plan spending. Moving on to the overall procedural unfairness, it took the NDA years. While I was only ever given 14 days to respond or comply, including paying large debts. Documents were inaccessible despite requests for alternatives. The debt letter stated the decisions were not reviewable, meaning no AAT review, no internal review, no oversight, and no way to clear my name. I was left with no choice but to engage a lawyer simply to defend myself and prevent debt recovery action. Unexpectedly, 14 months later, after the audit had started, I received a phone call, to Sam's point, to say I was now plan managed the week prior. Again, without notice, this meant I could no longer meet my legal obligations to run payroll the next day, as I had no access to my funds. Being forced into plan management didn't stop the ordeal. 6 weeks later, the NDIA audited me again via the plan manager. The plan manager became concerned enough to pause all claims. Things were stable enough for 2 more years, but in 2025, the plan manager concluded supporting direct employing participants was too high risk due to increased audit activity. At that point, I had no practical way to access my funding. So I asked, what are direct employers meant to do? The ATO is out instructing participants that in certain circumstances they must directly employ. The agency is saying I can't self-manage because it's a conflict of interest. And plan managers are pulling out of the market because they're wary. So where has this left me? In 2023, my lawyer received an email saying the agency will not pursue the debt. But I received no apology, no explanation, no correction of the record, no education, and no reinstatement of self-management. The debt vanished, but the consequences continue to have significant emotional toll and restrict my choice and control. I asked the committee to reflect on my experience, make audits genuinely collaborative, educative, and procedurally fair, treat participants as innocent until proven otherwise, with a real appeals process and a way to clear their name, and provide lawful, consistent guidance to self-managers and direct employers, and train NDI staff on the same material. Integrity must apply not only to participants, but to the agency itself. Thank you.
Thank you. And thank you very much, Ms. Shine, for sharing your story with us. It sounds like a harrowing journey you've been through, and hopefully changes that we are making are going to make a difference for you. I'm sure that there'll be members of the committee who wish to speak with you further, but I just wanted to return to yourself, Ms. Paylor, and just ask a question around the experience of people you self-manage more broadly. What are you seeing and hearing from your community when it comes to the issue of fraud, which is something we're paying attention to in this inquiry, both for fraud committed against participants and the way participants are being affected by integrity responses?
Thank you. Just for the committee's reference, that I have live captioning here, so I'm not surfing the web. I'm looking at captions.
That's okay. I mean, I do understand you may have hearing impairment, so
Yeah.
I do apologise if I spoke a little quickly then.
No, it was fine, and this is catching it, so all good, thank you. So the first question was, what is the self-manager's experience of experiencing fraud? We are not hearing a lot of that. I think in many ways, self-managers are the ultimate fraud detectors because we look at every invoice before we claim it. So we are always seeing what is happening on the ground, and we have to approve every invoice. And I think we're also very, very protective of our funds. So we just don't let things slip through. There are always, I would say up to 10 to 15% of invoices have errors in them. but self-managers catch most of that, we believe, and adjust them, get them adjusted accordingly.
Okay.
And
go ahead.
The second part of your question, which was around our experience of the integrity actions from the agency. I don't know how to put this diplomatically. Atrocious, really difficult situations. There is no current mechanism from the NDIA to check whether you can claim something or not until after you have incurred the expense, gained the invoice and submitted it. So there is nowhere to ask, is this okay to claim? So
there is a list of what's in and what's out now. Is that not helpful?
So I recently personally claimed for personal training for my son. He has Down syndrome and autism. If he uses his gym equipment at home without help, he could he puts too much weights on. He's not savvy about those things. Those claims were cancelled, being told that it was not an NDIS support, to which I responded and showed in the in list where it says personal training. It's written there. These things are often very clear, but there is no appeal process. So once that claim is cancelled, that's it. I can argue and I can discuss with them, but if they stick to their guns, which they did on this occasion, that's it. So I've had to go to the personal trainer and say, do you mind referring to yourself as a support worker? So we've...
and this is the issue of pricing is obviously, and the detail that's required, you're suggesting needs to be defined more so, and also to be I suppose, defined more and actually abided by with
pricing is not an issue for self-managers. We don't have caps on our pricing, so we can claim for a support worker at a higher rate if we needed to.
Right.
Because many, for example, Karen may well have a team leader that she self-employs who might be paid more than the regular support worker rate, for example.
Okay.
So price caps don't affect. We're still within the same envelope of funding, but price caps are not...
Okay, so look, I'd like to return really to the heart of this inquiry, which is about fraud and compliance. I understand that pricing is an issue, and there is, and I take on board your comments there. But look, what I would like to understand is, do you think self-managers can manage themselves and play a constructive role in the integrity of the scheme? And if so, what would help them, self-managers, to do that? And what currently gets in the way?
If I can just quickly refer to the survey that's in front of you from our submission.
Yes.
The types of sharp practices and fraud that self-managers are experiencing are things like, so there's a couple of examples of people overcharging, so going to a provider and because you're an NDIS participant they overcharge, and the immediate response from a self-manager is to be able to say, I'm not going to pay that, why am I paying that? So you're not managing someone who's between you and that payment process, you're able to manage that directly.
Thank you.
They also charge regularly for things that they don't receive. So what we're able to do is very carefully look at invoices, we're able to know whether that person was present or not at the support, and able to directly say, we're not going to pay for that. And that's something when you pass it on through a plan manager who doesn't ask a participant to check whether the person provided the support was there. So self-managers, as Sam said originally, they need some clearer education, they need accessible information that's much clearer about where to spend those supports. The in and out lists are helpful, but there are still lots of grey areas around whether that in and out list actually matches the goals of your plan. So it's trying to marry those two things together is actually quite challenging.
There's also no mechanism, like I said, to get pre-approval for a spending.
Okay, thank you. And so for those that are not capable of doing self-management, if there is a need for a plan manager, or alternatively they're managed within the scheme, what do you think it can be done that actually ensures that if you have a plan manager could be done to actually improve the integrity of that system to ensure the participant gets the support they need?
I think it won't work for everyone, but for the vast majority of people who are plan managed at least, if invoices needed to be approved by the participant before they went to the plan manager, I think you would see a lot of fraud and errors detected very early, rather than the plan manager just paying them and then trying to recoup that later.
Okay, thank you.
And self-managed participants also obviously use their nominees and they use other people around them to support their decisions, just as all of us do. So, supporting their decision-making with people around them is also really important. For those that have informal supports, it's a critical safeguard as well.
Thank you. And look, just to finish up, if I could turn to Ms. Shine, just broadening out that discussion, do you, from your experience as someone who's self-managed, would you say that there are any improvements we could make for those that are plan managed that would help the scheme?
I think for me, it is the training within the NDIA, and it goes to the point of when we actually validly claim something and they are rejected, that causes confusion in the community because people think they're doing the right thing and then they get told no. Then you get confusion in the community, then the rumours spread, and then that's how things start to slip through the cracks and people become unclear on what you can and can't do. And I think if it was a very clear policy and there was ways to check, and both providers and participants could check with the agency and even the plan manager. Like I might call my plan manager and say, hey, can I claim this? The plan manager will say, go and ask the NDIA before we'll put that through. There is no one to go and ask at the NDIA. So we can't do that. So we can't validly check claims in any way ourselves.
Okay, so you think more the plan managers need to be trained and have a clear understanding of what can be claimed and be able to...
Sorry, it's not the plan managers. The plan managers are generally pretty good, like the participants.
Okay.
It's actually inside the agency that the problem is. If we contact the call centre or we're in a plan meeting with a planner and say, I like this item in my plan, and that's what all my fraud claims were about, they were valid things I was allowed to do. And somebody said, no, you can't. And I had no way to climb up the management ladder and say, this member of staff needs training, they're actually wrong. I even had a lawyer tell them they were wrong, and we had no way to climb up the agency to. So I would say it's the knowledge inside the agency. I think participants generally know what they can and can't claim.
Okay, well, look, thank you. That's very useful information. So I would now like to hand over to the Deputy Chair.
Thank you for your time today. You describe self-managers as the eyes and ears of the scheme. The Commission can only act on misconduct that it's told about. What proportion of the overcharging that your members detect is formally referred to the Commission, if you have an awareness of that? And what proportion is directly resolved with the provider? And in your view, is this a systemic issue, as you say, if a participant isn't checking off invoices? What is, in your view, potentially the scale of this problem across the scheme?
I would need to take that on notice and survey our population.
Sure.
But my gut feel would be that most of the invoices, when there are errors, that they are not deliberate errors, they are not fraud as such, and participants are catching those. In terms of what's reported to the Commission, I don't think people report when there are errors like that. People go through the complaint processes with their providers and get them fixed. So if a provider doesn't fix it, then I think a significant proportion of our people are making complaints where a provider is genuinely dodgy.
Sure.
Yeah.
And the NDIA cites, I think it's an 8.5% critical error rate on self-managed plans, and they use that to justify a tighter compliance. But based on the evidence of Ms. Shine, there doesn't seem to be much benefit of the doubt afforded, or even communication clearly around whether something is actually an error or not, or whether it's a misunderstanding. Do you have any thoughts or guidance for us on errors that are attributed to self-managed plans that aren't actually errors?
I think one of the big issues with certainly the media reporting is that there's this huge percentage of self-managed claims that are fraud. They're calling it fraud. And that includes when a participant, in the numbers that are coming from the agency, that includes when a participant makes a claim and then incidentally claims the same invoice again and then goes straight back and presses cancel. That is counted in those dollars that are being reported as fraud. So there's a whole lot of stuff in there that is really mislabeled, and really quite damaging for self-managing and unwarranted.
So just so I understand that, so you start a process, you need to cancel it because there's an error or something like that, so you haven't submitted it for payment, and that is calculated as an error on your part?
Yes, and for example, just personally, 3 weeks ago, I put in a claim. There were 2 invoices for the same provider attached to that claim. I put the claim in, it was cancelled. I got a letter saying you didn't match, blah, blah, blah. The app had only uploaded one of the 2 invoices that I'd uploaded. Now, I couldn't add it to the old claim and fix it. I had to create a new claim and do that. But in the meantime, that $4,000 claim is counted in those numbers where we're reporting as fraud. It's not fraud.
That's extraordinary. And how often would something like that happen? Is it an anomaly? Is it something that happens more regularly than it probably should?
We make mistakes.
Yeah,
the
we're
app,
human, right?
Yeah, and the app is not. It's okay, but it's not great. You have to press every button twice.
Yeah.
For it to submit. You have to scroll to the bottom. It doesn't automatically come up to the top. All sorts of things that it does that make things difficult to get it right.
Yeah.
It's come a long way.
Yeah, and a lot harder than perhaps it should be.
Oh, don't you love it when you use your healthcare card and you just tap and it's done?
If I can just add to that, 40% of our respondents in our survey said that they'd been subject to a review that they'd been unable to have any response over. So they're feeling fear. There isn't, as Sam said, there's no way to actually counteract the mistake that someone's made, and then it's really challenging for them to fix it. And as Karen's experienced, this all started her $21,000 debt because of one small error that she did at the beginning, and it just led to really her being targeted for over 3 or 4 years for a very small error.
So when that second invoice, for example, didn't upload to the system and I got the cancellation letter, it says all this stuff. It says, look, you can resubmit if you've got more evidence or whatever. And then the next paragraph talks about how we could take your self-management away and we can raise a debt if you do something wrong. So then I sit there and I think, oh my gosh, have I actually done something wrong? Am I in trouble? And we're feeling huge fear in the self-management community. And the benefits of self-managing and engaging your own workers are significant. And we're in this really tough place where the ATO is telling us that we can't use independent contractors for more than X hours a day or whatever, so we have to self-manage them, but then we're getting in trouble if we claim the workers' compensation insurance, which we're obligated to do. So, there's all of these really tough, I don't even know how to explain it.
The interoperability of all of the systems that are meant to work together to support us, to either help ourselves or the people we love live their best and safest lives, are impossible. And it saves so much money. It's important to remember that self-management means that we're actually not paying those fees. We're getting people who have the right skills and the right support for the right money, and we're able to directly negotiate with those contractors and staff every day.
And by self-employing some of those workers, we get longer-term employees who know the participant, who can manage those behaviours of concern where they present. And you get that longevity. You don't have that turnover. You don't have to retrain people. I mean, these are huge cost savings for the scheme.
You also get to choose who sees you naked every day, which is a fundamental human right.
It is indeed. Absolutely. Yeah. And look, I understand and acknowledge that completely, and I think that any person has a right, but particularly someone who is vulnerable or has a disability has a right to choose who showers them, and that shouldn't be determined by a computer system
And
or
the
by someone
worker
who
should,
doesn't know them.
and the worker should have a right to get a home loan too,
Yes,
and they're not going to
correct.
get that as a contractor.
No. they
So
won't.
if we can
Sorry.
move on from here, in the interest of time, I'm wanting to now invite Miss Brown to speak.
Thanks, Chair. So just to continue that conversations, and you know the government's looking to make a huge investment in terms of overhauling the system in terms of the framework. So what do you want to see? Here's your opportunity. What would you like to see? You know, government include.
You go? You go. The computer system. So I think, you know, I'm going to hold off here because I'm going to take. Can I take that on notice, please?
Yes.
Do you have
I
something
think
you want to add?
we need a computer system where the framework is co-designed by the people who are actually receiving the service. So that's where we need to start. Is what are the outcomes? What's the outcomes and the wellbeing framework, I suppose, of what we're trying to help people live their best life for. And so the system has to then reflect what the outcomes are, not just put in compliance that actually often means that those outcomes can't be met. And so I think starting at that point is really, really critical.
Yeah. There's definitely a place for a strong digital payment system, though.
Yes.
No question about that.
Well, if you could take that on notice, I would appreciate that and use that as your opportunity to let the committee know your views. Now, in your submission, and also it has been mentioned in a response to a question, you talk about sharp practices, and you recommend that integrity efforts should be focused more around provider sharp practices. But what have you given any thought to what compliance mechanisms you would propose to better detect and deter those sharp practices, you know, overcharging, hidden fees? Have you had do you have a view?
I think self-management intrinsically addresses that because we're looking at those invoices and we're fixing those things as we go along.
But for those people that don't want to self-manage or cannot, but have you had a broader look at what you would like to see in terms to address sharp practices?
I think if we look at other insurance schemes, we can make some parallels, and so having a standard of what's allowed in a market and what people can charge is really, really important. And that gives self-managers and every NDIS participant an understanding of what they have to pay. But it also, on the other side, it enables providers to understand what they can charge. So I think those two pillars have to come together. Otherwise, participants are constantly trying to argue with many, many systems where they get their services from about what's reasonable in terms of charging. So that's the first piece, is how do we create a market where there are guidelines around what people can charge so that people aren't benefiting from vulnerable people is a really important factor.
Okay. Thank you.
Thank you. Over to you, Senator Little.
Thank you. You provided in your submission some examples of sharp practices. What's your view on forcing providers to be registered? Will that decrease the incidence of sharp practices?
I think we've got some pretty strong evidence that there are plenty of registered providers that are doing plenty of sharp practices. I'm a registered provider myself. I've been through, I think, 6 or 7 audits now, and I can tell you that none of those audits or my registration would prevent me from engaging in sharp practices. There is nothing in those processes that have any value, nor do they measure quality of our service in any meaningful way. We do it simply so that we can actually serve people who are the most vulnerable as agency managed participants. But I think visibility is incredibly important. Some mechanism of enrolment, which I think maybe speaks a little to Carol's question, Senator Brown's question. Enrolment is really important. We need to know who is out there, because we know that there are people with ABNs that are charging 40 hours with one participant and 60 hours with another in the same week. And if we've got visibility over what they're claiming, then I think that that's valuable. But it can't be, I don't think we need a over registered process that doesn't actually add value.
Okay. Your survey refers to 60% of respondents saying that they were, or a person or a provider tried to charge them for something that they didn't receive, or there was information in there, or that there was undisclosed items in there. I'm interested to understand, when a self-managed participant actually picks that up, where do they go to make sure that that person just doesn't go on to the next person and moves on to someone else?
I think mostly they do. The first thing they have to do is not pay and to negotiate and to not use that provider anymore, and then find a new provider. So we do need to remember that self-managers and their families and carers are doing a lot of work on the day-to-day trying to provide supports. But certainly then they use the same reporting systems that I think every other participant does. That's not picked up. I made a complaint about a provider 2.5 years ago to the Quality and Safety Commission. I have received nothing yet. So it's not like that reporting of sharp practice is going to make a difference straight away. Absolutely, it goes towards data, which is really important to change the system, but it's not going to change the right now. So lots of self-managers will go and report it to anywhere that they can, because we're really aware of the strength of numbers in terms of reporting on people's practice and making sure that those people aren't then working with other vulnerable people. The initial benefit is you can just not pay that person and you can get someone else straight away.
I think if you look,
Yep, sorry.
Sorry, if you look on our on the Facebook group, we've got 16,000 members in there, and genuinely 12,000 I think are active within every month. So it's a really active, engaged community. And in that community, whenever anyone talks about someone's overcharged or done the wrong thing, everybody else piles in and says, here's the link to the Commission, here's the link to the, to the Consumer Advisory organisation for your state, all of these other systems as well. So, it is a community that does get involved with that, because we don't want other people to be mucked around like we were. It depends too, obviously, whether it's a genuine, just an error. The provider cancelled a therapy session and then the information didn't get back and they got charged. But
so in terms of a model where you've got people who are actually receiving the service being, in that case, complaining about a component of that service to someone, it's one thing to have a system, it's another thing to actually feel like you've been heard in that system. Can you tell me a little bit about what people might say about fears of their confidentiality being breached, of their safety in reporting that, or even the effort that they want to put into reporting it because they feel like it's been heard? Absolutely,
and I think that's reflected in our Facebook group. We've noticed an absolute increase of people being more anonymous on Facebook about their complaints, because they're really fearing retribution. They're worried that the agency is going to pick that up and they're going to follow them or track it. So I think that's a first piece in reflecting that people are really concerned.
Just in the interest of time, if you could keep your answer, if you've got anything further to say,
Yes.
just fairly brief, only because we're running a little over time. Did you want to add anything else? Sorry. Okay.
You're also welcome to put additional comments.
Yes, you are absolutely welcome to do that. And we do have Senator Steele-John, who's been waiting patiently. Over to you, Senator Steele-John.
Thank you, Chair. So, Ms. Payer, if I could just take you back to one of your previous answers. You're a registered provider, correct? And your registration is current.
yes.
Yes. And in your experience of the process and what you were required to undertake, you would say, you've said to the committee that there is nothing in that process that eliminates or prevents sharp practices or necessarily identifies them. Is that correct?
Correct. The only quality measure that I see through those processes are where the auditor calls and speaks to our participants and our staff. However, that is effectively a self-selected process, so I could choose my 5 favourite clients and send it to them if I wanted.
So you can identify the people that the...
I could just say that these ones don't have opted out of the process.
And in terms of quality, so that was the only sharp practice avoidance, which, like, that's a very kind of bureaucratic term. We're talking about abuse. We're talking about abuse of people. So that was the one process, and it's completely circumventable for
Correct.
you as a registered provider.
In my opinion, that is correct.
Yes. Well, in your experience as a registered provider.
Yep, absolutely.
And then you talked about quality, that there was nothing in your experience of that process that really guaranteed quality either. Is that correct?
No, only those interviews.
Only the interviews again. So when we hear in this debate around what we should do around fraud and the quality of provision, really we're just talking about one self-selected part of the process where you can pick your favourite clients to report.
Yes.
Yeah.
I believe that is correct. I'm always a little astounded at that process that what I can do is I can give the auditor a list of all of our clients, de-identified with numbers, and they can choose which numbers that they want to get the numbers for. But of course, they don't know who those numbers relate to, so I could still just give them my 5 favourite clients.
Okay. So then, what to be quite blunt with you, like, what was your experience of the registration process? Like, what does the process actually test for? If it's not quality and it's not whether you're abusing people, what did it test you for?
It looks at written policies. It looks at documentation. We got a minor non-conformance because I didn't have my own 100 points of ID and evidence that I'm allowed to work in Australia uploaded into our HR system.
Right.
As a director and justice of the peace, which they did have that evidence, but yeah.
So it tests you for whether you've got the documents. Well, are the documents you're required to provide, are they related to quality or sharp practice management?
Not that I'm aware of.
Just ID. Anything around a fraud control framework or?
A what, sorry?
Like a fraud control policy or anything?
We don't do support work. We do support coordination.
Yes.
They did look at whether we had appropriate care plans in place, and that was actually unrealistic. We have clients who are given 6 hours a year of support coordination, and we were expected to develop risk assessment, care plan, emergency management plan for each of them.
Coordination.
Level 2 support coordination.
Good Lord. Okay. All right. Well, thank you. That really helps us shed light on whether mandatory registration would in any way
as it
tackle
currently
this problem.
stands.
Yeah, exactly. But there's not many plans to change that, just to make everybody have to register. Okay. Thank you, Ms. Payer. Can I go to a fascinating observation way back at the beginning of your evidence? You said, can you give us? You talked about self-managers as agents against fraud, as a preventative measure against fraud, and in favour of value for money for the taxpayer. So could you give us an example of the cost savings that you are that are available to you as a self-manager?
Yes. At the risk of exposing my son's personal situation, he house shares with another young man with disability who is his best friend, but he also house shares with 2 other young people who are not disabled. Now, my son and his other disabled friend require overnight passive assistance, which would normally cost, I think, $350 a night, I think something like that in the price guide. We have an arrangement with the unpaid, with the housemates who provide that informal support overnight, and they're just another regular young couple that we found on flatmates.com, and we we have an exchange with their rental costs, for example.
Yeah, right.
So we're saving the scheme thousands of dollars.
Yeah, through
doing
that
that
process. Yeah.
Yeah, and my son and his friend are living a life without a revolving door of support workers, without all the changes of people, and living with other people who actually value and treat that home as a home. So it's a genuine, awesome house share. It's not a group home.
And Ms. Coots, you spoke about the importance of having the ability to determine somebody that involves themselves in your personal care. You described, the right to decide who sees you naked in the shower. One of the things that I've had feedback from the community on is the proposal that support workers that undertake those types of support would have to be mandatorily registered because of that type of contact, potentially limiting the options available to people. In terms of then a self-manager being able, to utilise that support worker they currently have a relationship with, does that create broader concerns for you on the way that mandatory registration may in fact restrict the options available to those that self-manage?
Thank you for the question. I think it's really important, and self-managers do this regulation piece really well in understanding the skills that are needed to, for example, help them in the shower or to be their psychosocial recovery coach. And so part of self-management is understanding the right skills and values and cultural and psychological safety fit. So in answer to your question, part of the journey of self-management has been to start building capacity for people to understand the best person to provide those supports to them. And I think there will always be exceptions where you can't find anyone who might be registered from the right culture or from the right religion. So I think those exceptions always have to exist. I think we believe people should be enrolled. And I think where it comes to the delivery of services, we have to be careful because of that, but we also deserve to have the best service possible. So I think it's possible to be able to choose from people who do not have the special skills. It might be that you're tube feeding, you need those skill sets, but you can also train people who come to you to do that for you so that you are safe.
Yes, you can, and you often have to anyway.
That's right.
My last question is to Ms. Shine, because I know you've waited very patiently externally for questions. Go right back to the beginning of your story and the kind of claim that started this whole snowball nightmare that you were forced through by the agency for 4 years. You talked about a double claim, an invoice that was submitted on the same day that crossed over, and you talked about that being something you had a right to do as somebody exercising choice and control, so that we have a tangible example of what you're talking about. What did that actually look like, that bureaucratic crossover? Why did it occur?
Okay, so as a self-manager and even any plan or agency manager, any participant, you have numbers of suppliers for safeguarding, quality and availability. So even if you just look at support workers, very few people just have one provider. They would have multiple agencies, an on-call agency, a normal agency, 5 or 6 independents, several employees. So if each of those are working different shifts that week, you could end up with 5 to 6 invoices for this week from suppliers for support work. And when I put those in, if I put in a claim from Monday to Friday this week for support work, the first one was considered valid. Everything else I put in for that week was then considered fraud. They didn't look at whether the first person arrived for Monday morning between 7 and 10 and the second person arrived Monday afternoon for 5 till 6. They didn't compare shift times. It was purely invoice dates, and that's how the debt got so large.
Okay. Thank you. If you want to provide any evidence to us on notice detailing that case study, more than you already have in the submission by Self-Managers Hub, we'd really welcome it, obviously within the boundaries of your own privacy as well.
Thank you.
Thank you. Thanks,
Thank
Chair.
you very much, Senator Stiljohn, and thank you so much for coming along today and sharing your experiences. Very valuable. We really do appreciate it. And if you have taken any questions on notice. There may be one or two of those. The committee requests that information be provided within 2 weeks by Friday the 29th of May. However, if you need more time, please liaise with the secretariat. So thank you very much for your attendance today. I would now like to welcome Intellectual Disability Rights Services New South Wales. I would also just like to acknowledge that Miss Carol Berry has joined us. Welcome.
Thank you, Chair.
Hello and welcome this afternoon. Thank you for joining us. I would just like to mention a couple of things. I understand that information on parliamentary privilege and the protection of witnesses giving evidence to parliamentary committees has been provided to you both. And for the Hansard record, if you could please state your names and the capacity in which you appear today.
Judy Harper, Acting CEO of the Intellectual Disability Rights Service.
Alexandra Craig, Principal Solicitor of Ability Rights Centre, which is operated by Intellectual Disability Rights Service.
Great. Well, thank you very much for being here. Would you like to make a brief opening statement?
We do have a brief one, if that's okay.
Yes, that would be fine. Thank you.
Okay, thank you. So the Intellectual Disability Rights Service, or IDRS as we're known, provides legal and advocacy services to people with cognitive disability across New South Wales. We're the only service of our kind in Australia, and our submission and experience draws on decades of direct legal casework and support. We operate the independent community legal centre for people with disabilities across New South Wales, which covers all types of legal work. And jurisdictions, and the Justice Advocacy Service, which provides specialist disability advocacy to people who are involved in the criminal justice system in New South Wales. We support over 3,000 people every year, and 42% of those people identify as First Nations. So we specialise in working with people with intellectual disability, including those with other conditions that come under the definition of cognitive impairment. And the people that we support are some of the most marginalised individuals in a society, many of whom are NDIS participants or who face compounding barriers to exercising choice and control over their lives. And we do also like to note and highlight that the people that we support are by far the majority participants of the NDIS scheme, but are often the ones with the least voice. Some of the key points we just would like to highlight to begin with is that non-compliance, poor practice and sharp practices are widespread and target the most vulnerable within the scheme. And the Safeguards Commission does not have the capacity or enforcement powers to respond or ensure change in our experience. People with intellectual disability experience a distinct and heightened form of vulnerability in the NDIS marketplace, and the existing protection frameworks fail to address these. And this is particularly so for those who are connected in any way with the criminal justice system. The market response is not and has not been effective for this group, and it will not grow effectively to meet the complex needs of people cycling through the justice system because, frankly, there's no incentive to do so. The flaws in the system result in jail becoming the accommodation provider of last resort in New South Wales, in our experience, with increasingly higher numbers of people with significant and complex support needs being incarcerated. Independent accessible advocacy is critically important and needed, but is chronically underfunded at this point in time. And some of the initiatives put in place to address fraud to date have actually resulted in more limited choice and reduced supports and increased administrative burdens, particularly for people with an intellectual disability. And our written submission provides a number of examples of specific cases that are indicative of what we see consistently through the people that we work with and support every day.
Okay. Did you want to add anything to that, Ms. Craig?
No.
Okay. Well, I'll begin with a couple of questions just relating to really a lot of the focus of this inquiry is relating to fraud. It's also relating to compliance and how do we do things better to support participants and those, to ensure that we have a good, honest system that works for participants. So my first question is, what are the distinct challenges people with intellectual disabilities face in the NDIS, particularly when it comes to integrity, to fraud and to safeguarding? And safeguarding is so important.
Safeguarding is very important. So part of the challenge is that, people with an intellectual disability, like any people with a disability, are individuals, and there is a wide gamut of needs and supports, and really the system does not necessarily work particularly well at this point in time in addressing those. And despite the intent and for some people being able to exercise a lot of choice and control, often we see that choice and control is limited, and that choice and control is far more on the side of providers than on the part of a person with an intellectual disability.
So how do we change that?
How do we change that?
What sort of systems can we put in place?
So I suppose some of the things would be around transparency, around accessible information, even something as simple as we've highlighted in our submission, service agreements with providers being in accessible formats, people actually understanding what they're signing, so any form of supported decision making, any form of informed decision making, and ensuring that those agreements are not exploitative in and of themselves. And for people with an intellectual disability, with varying broad and varying capacities, their ability to do that, varies enormously. Not all people with an intellectual disability have an engaged and positive family support or informal support network. Those that do tend to do very, very well. The burden on the families is often enormous because of the systems, particularly the administrative burden and the stress and anxiety, but certainly at least there is some degree of oversight. But for many of the people that we support who are particularly cycling through the criminal justice system, they don't see anybody. They don't see a NDIS planner. They don't see a justice liaison officer in person. Those conversations are not even had with them. I was speaking to one of our advisors at IDRS last week, and he ended up figuring out after a 10-minute phone call that he had on a train, which was just a cold call from the agency, that they were counting that as his plan review. Now, he knows enough and understands enough to have raised that with an agency like IDRS and say, this is not okay, what's happening. But for many of the people who are cycling through the justice system in particular, that's not on their radar. They're not aware. They wouldn't know who to go to. They don't necessarily know that there is anywhere that they can complain. So and I suppose
I think needs that the area in the justice system, we need better checks and balances there, and the systems that are currently in place, from your perspective, are not working sufficiently. So I suppose what I'm trying to get down to is, we're about making recommendations that are going to improve. And while I hear what you're saying, and I certainly feel for people that are, these situations are happening, we need to find solutions. And the government is very keen. We've already implemented a number of things, but there's more to do, obviously. So if you had to choose, what would you say would be one thing the government could implement in terms of improving the integrity of the scheme and lessening the fraud within the scheme? What would it be?
Greater oversight and greater focus on oversight and compliance and responses, I suppose. So checking, for instance, about the accessibility of plans, and are people understanding what their agreements are, knowing that that complaints processes are accessible and there is a way that people can raise those, but also that something will actually happen. So, there's a litany, as I'm sure you've already heard, and we've got many examples of where things have gone awry and sharp practices and really horrific situations for people. The visibility of that is not there, and that's where, again, with the Safeguards Commission, who we met with recently, they're very concerned about particularly what happens for justice-involved people, but again, have very limited capacity to respond. It's done through an individual complaints process. So again, there's not necessarily a way to go and say these are systemic issues, this is happening with this particular cohort. So definitely a much improved oversight around being able to raise issues, complaints, and quality of providers.
Okay.
There's not that oversight.
That having the commissioning of providers would be helpful?
In some instances. So again, in terms of registration, the registration process, as we've just heard from the previous presenters, doesn't necessarily check, but it's not necessarily an appropriate check or balance in terms of registering.
But it can actually identify and enable government to understand who is actually even working in the scheme.
Yes. So
but could there be levels of registration?
I was going to say that was exactly... So levels of registration according to the types of services being provided. So where you've got, people in very high support needs situations with very complex needs, the registration process for that needs to be very different to the registration process for someone who is getting a few hours of support a week to go and access and undertake particular, activities in the community. And so varying levels of registration, I think, is important, and according to the situation, and particularly looking at registration where it often looks at the type of service, so, SIL or, the actual type of service, but I think it also needs to look at cohorts of individuals. So looking more closely where people who are involved in the criminal justice system and who are cycling, that there's much more oversight of those providers, because what we see in that area is it's much easier to really defraud and impact on people because they're cycling in and out of the system. They don't necessarily know what's in their plan. They're not engaged in the system. They don't understand how it works, and they don't have a support network around them to help them do that.
Well, that's a very important point you make. So I'm sorry to move.
No, you're
quickly. Right. I'm just concerned about the time. Just going back to that, having providers that are selected in a sense as preferred as part of a commissioning process, do you think that has merit?
I do think that has merit for some cohorts, yes. Not for everybody, and we don't, and again, I think the real risk with some of this is, in some of the things that have happened in the past, is the strategies put in place to reduce fraud, with very good intentions, have actually also served to restrict choice and control for some participants because the gamut is enormous. So again, not looking necessarily just at the type of service provided, but who those services are being provided to, I think is actually critically important, because you don't want to disadvantage people who are able to exercise much more choice and control, have support networks, wraparound supports around them, or where where the agency, and I don't even know if the agency does know who the excellent providers are and where the high standards of providers are. I don't think that's known,
that's something
to be
that
honest.
needs to be worked on, doesn't it? So
Yes.
just my final question before I hand over to the Deputy is digital platform that actually streamlines processes, makes it easier for self-managed, but also, I suppose, enables more checks and balances in the system. Do you think that will be a benefit?
It could be for some people, and it depends what that digital platform looks like and how it works. Because
What
again,
does it need to be?
well, it's really that question around how do you monitor and determine and encourage quality. And in terms of the market system that we have, the market system is very much driven by, filling gaps, covering costs, making money, whatever that is. It's not driven, there's no incentivisation for quality. There's no incentivisation for quality or for care or for doing the right thing, frankly. And there are a lot of really great providers out there who, probably to their own detriment, are providing an excellent service, are barely covering their costs, and are no more recognised than the providers who are providing the same service very, very poorly and actually making money because they're not delivering, or they are defrauding the system.
To actually acknowledge where quality lies amongst providers, but perhaps having a set of preferred providers, not cutting everyone out, but actually having where you do know there's integrity and quality, could be a value.
It could be a value.
And that's, so look, it's It's an interesting.
And again, it's the balance between people being able to exercise choice and control, but also acknowledging that at some points in time, for some people in their life, they don't have capacity to exercise choice and control at that point in time. When somebody's exiting jail to literally nothing but besides what they're standing in, choice and control is really not your highest priority, you know, unfortunately, but that's the reality of the world.
So at least to know that you can go to a particular provider and they're seen as being credible, you know, having integrity could be of value. And for people when you first enter the system, perhaps.
Could be.
Yeah. But look, thank you very much. I've enjoyed my discussion with you, and over to the Deputy.
Sorry, I didn't give you a chance to even jump in.
Thank you, and thank you for your time today. At the last hearing, ACIC told us that organised crime is directly exploiting people with cognitive disability in the NDIS, and that includes a pattern that former Minister Bill Shorten described, where people living in prison are placed in halfway houses, where there is a deliberate business model of effectively harvesting NDIS packages. Your casework shows plans drained in months while clients sat in custody, people held on remand longer because bail supports were never set up, and people reoffending on purpose for those same reasons. Based on your experience and what you have seen, what are the minimum legislative changes, and not a voluntary roadmap, because I don't think that people who are deliberate perpetrators of this kind of thing are going to adhere to a voluntary roadmap. So what legislative changes does this committee need to recommend to just shut this pattern down, to cut these people out of the system?
I think it goes back to, again, looking at the registration process for particular cohorts, and where we know, for instance, that people are being targeted and we know that this cohort is being targeted.
But do you think and I want you to continue, but I'm just curious, do you think registration
It's
alone...
not the only answer,
yeah,
no.
They're going to find a way to be registered
that's exactly
and do this,
right. So, and I can give you a very good example of that we found out about a couple of weeks ago. It needs to be, it's a continuum. So whilst you need to have a registration process that's robust and that looks for those things, nothing is perfect, and people who want to find the wrong way around things will. So again, it then comes back to those processes of checking, of auditing, of going back and of visits. One of the things that we have recommended is that we should have some system where, whether it's the Safeguards and Quality Commission or where concerns have been raised, that you should be people should be able to go and do spot checks and actually look at what is happening, but also have access to the people who are there. Now, some people will be well aware of what is happening, and other people will be completely oblivious to that because they're deliberately shut out of having any visibility of those. If they don't have any advocacy support, and again, this is where targeted individualised advocacy support, when it's available, that's how a lot of these things are found out. Again, it's difficult to get through any sort of process to highlight that those things are happening and to have anything done about it, but it is being identified to some extent. And so it's about a continuum, and again, it's about incentivising quality through the questions that are asked, through the monitoring that happens, through evaluation of what is being said and what is being done. So it can't just be one initiative that's going to make a difference. It's really looking at how things are through the lifetime of the scheme. So we recently had a client that we're supporting who their provider did actually end up getting shut down because they were dealing drugs to the clients to keep them in the service and rorting money out of their packages. They were shut down, which was great. It took 18 months, but they were actually shut down. But the couple's daughter then went out and set up exactly the same service and exactly the same model with the same things happening within a 3-month period. Sorry?
Registered or unregistered?
They were registered,
right.
Yeah. So again, it's an example of where registration is not the magic bullet or the solution to everything. No, it's about evaluation. It's about monitoring, and again, it's about incentivising quality. Some of the providers who do astounding work are doing it because they have a genuine interest and a genuine care in supporting the people that they're working with and making a difference in their lives, and go to great lengths to employ quality practices and to make sure that they're compliant. And where you've got providers who aren't showing that level of interest or desire, then you would want to be questioning why they're actually registered as a provider and who they're providing support to.
Sure.
Can I just add to that? I mean, I guess it feeds into the issue that we can't just rely on complaints processes because many of our clients aren't in a position to be able to raise a complaint, one, particularly because they've got intellectual disability. It's much more harder for them to have a voice. But also they're very often dependent on the supports that they're trying to complain about to help raise those issues. So yes, we want to strive to make the complaints processes more accessible, but that alone won't solve some of these issues. And particularly, I think it does indicate a strong need for people to have independent advocacy support to either to raise complaints or to negotiate service agreements or to help them with supported decision making.
Thank you.
There are also practices within the NDIA, practices within the NDIA that are not reliant on legislative change or anything like that. It's actual practice of the agency. And so they're practices around how plans are completed, that the fact that they do allocate support coordinators or override people's decisions, choices about support coordinators without any consultation with the person whatsoever.
Do you know what triggers that?
They do. I would suggest that it's capacity, lack of training, lack of understanding of the systems that we're working in. We recently, a colleague recently was able to conduct some training for the Justice Liaison Position Officers. So this is an external organisation. The Justice Liaison Officers were incredibly grateful, and it was training about the justice system and training about disability, and they were saying this is information that we don't have to do our jobs. So there's a capacity and training issue for the people employed in some of the positions within the NDIA, and particularly in the planning network. Again, consistency is not there. You can get an astonishing planner through the complex support needs pathway, and you can get a person who won't even speak to the client and will write them a plan and send it to them without even having spoken to the person directly. So just even within the NDIA, there are many, many things that could be done. And again, they would be protective factors in terms of there's a Justice Liaison Officer, there's a planner involved with that person's life who is supposed to be talking to their providers. They're again protective factors within the system that are already there that could help to identify where there are issues. But it's not working as effectively as it could or should.
It sounds to me from what you're saying then that it's an agency that is completely overwhelmed with trying to manage a scheme, and effectively there is a scattergun approach to actually dealing with any issue that turns up, and someone will get that outcome and someone will get this one. There's certainly
no consistency. And, through our NDIS appeals program, which we also provide, we see that regularly. And again, decisions that are made around plans, and all of a sudden plans being halved without any information. You regularly hear about, we had a person the other day whose father left full-time work because their plan was halved, and even though they were putting in an appeal, it was going to be 9 months to get through the system, and in the meantime they had that reduced plan. So he left full-time work in order to provide the care required with his wife to their child.
I'll be very, very quick. Super last question, yes.
Sorry. We have someone on the line who has to ask a question.
Indeed. Your submission identifies providers signing people with intellectual disability up to service agreements that they don't have the capacity to understand or to consent to, and the NDIA's own reporting suggests that these contracts may not even be legally enforceable, which is a problem. But the response again to this is a voluntary response. With servicing, and I think that's with the Service Agreement Improvement Project, I think that's what it's called. Do you believe that the committee needs to do something further in relation to that, whether it's to legislate or mandatory requirements around capacity assessments and express application of unfair contract terms? Like, what are some things we can do there to take away, if you're doing the wrong thing as a provider, we would like you to voluntarily agree to improving your own behaviour. That's not going to work. How do we... And just quickly, otherwise on notice is great.
Yeah, I mean, I guess I just want to reinforce that it absolutely is the case that many clients come to us with service agreements that they have no understanding of, and I guess our job is to give them legal advice about what options they have, and the reality is many legal options are not available to people. Yeah. Are they realistically going to file an application in court against their service provider to enforce this contract that nobody understands? And there's a lot of question marks about who's responsible or not.
And the bad actors know that, right?
Yeah, that's right. And essentially, and then they play on it, that then they use the fact that the person doesn't understand the agreement to exit the client or say you've breached the agreement. But as far as what things would actually improve the situation, I mean, obviously uniform and consistency of what service agreements are, having clear places for people to actually raise complaints about that. But then we'd probably take on notice, I think, to provide some more information about any other changes.
Thank you.
Yeah, thank you. I mean, I think that would be of value to get your further thoughts and information on that.
Yeah.
Thank you. Senator Mulholland, you've been waiting patiently there. Thank you.
Thank you, Chair, and thank you to Ms Harper and Ms Craig for joining us today. I've had a good read through your submission. It makes about 18 recommendations. A couple of the recommendations I just wanted to touch on were, I think we've already dealt with the registration issue, so I'll move to conflicts of interest. So recommendation 4 in your submission talks about prohibiting plan managers from holding provider relationships with participants that they may manage. Can you just talk to me on a sort of a headline level around why you feel that recommendation is important?
I suppose, and again, can sometimes be an individualised situation, but I suppose the areas where we have seen it enables more control, I suppose, over the person's plan and the relationship, and even if there's no mandate for disclosure of all related party transactions. So again, for those people who want to exploit it, I mean, there are plan managers who provide services who do the right thing, like in many other instances, but where you want to exploit it, where you can have a plan manager being, X person in a business and their, partner is also the person in the business and they're providing services, or it's their daughter or, a relative, and it's all kept within the same service and that's not disclosed. Again, it's just one of those areas where it comes up for abuse and there's no requirement to disclose anything in relation to that, or people who are multiple providers who provide different types of businesses within the NDIS. There's opportunity across those. So some of it is about mandatory disclosure to actually review whether it's a problem or not. But again, in many instances, it would be preferable for those functions to be separated.
Sure. Thank you. I think it makes perfect sense to have that level of disclosure out there and to prohibit some of those activities. I think, particularly when we're dealing with an extremely vulnerable cohort.
And again, it might apply to different cohorts in different ways. Again, you don't want to put strategies in place that then, impact and reduce and choice and control for other participants either.
Sure. There's been a bit of a focus this morning on payment systems and using technology to be able to have better invoicing, but also picking up on anomalies and issues to do with payments and plans. Your recommendation number 5 talks to a real-time payment system as well to be able to pick up issues. Can you talk to me about why you think that's important?
I suppose just because if payment anomalies or issues are picked up now, it often takes a very long period of time for that to happen or for that to come to light. And so really looking at systems where there is that real-time payment, where there is proper, investigation of legitimacy and those sorts of things, would hopefully overcome the I suppose, the fraud issue, but also the time that it takes to happen. Because again, if somebody's had their plan drained of, $40,000, and that's, more than half of their plan for the year, and you take 6 to 9 months to resolve that situation, they're left high and dry for 6 months of the year. So the timeliness is one of the issues, because even when it is picked up now, it takes a long time for it to be acted upon.
Thank you. And my very last question, Chair, is just around the recommendation, I think it's number 8, around worker screening. So currently the NDIS Act does establish worker screening, but it doesn't apply to all workers delivering supports. And I believe that is the recommendation in your submission, is to extend that worker screening to all direct support workers dealing with participants with intellectual disability. Can you just talk me through why that's an important recommendation?
So I suppose that's important because of the reasons that we've highlighted why people with an intellectual disability are often more vulnerable to the vagaries of the scheme and to abuses within the scheme and providers of the scheme. And a lot of unregistered providers are particularly targeting people with intellectual disability who are more marginalised, so those who are on the fringes, who are cycling through the justice system, who don't have networks and support around them. So again, looking and being able to track, which would be possible through people's plans, that a person is involved in the justice system, and looking at who's providing to those people would be really important. It's not a magic bullet, but it's one of many things that could be put in place as a protective
layering,
factor.
isn't it?
It is layering, and as a protective factor, and again, to ensure, and again, it would be tricky. It would be, more difficult or trickier in some respects. For instance, for First Nations communities who want to use people who are known to them or people from their community. But again, the screening and those sorts of things doesn't necessarily have to be a hugely onerous process. It's really about having that visibility and being able to identify where those potential gaps or risks can come up for abuse and exploitation.
Thank you, and I'll hand back to you, Chair.
Yeah, thank you. Over to you, Senator Steele, John.
Thanks very much, Chair. Thank you so much for your evidence so far today. You mentioned in one of your answers to one of my colleagues that one of the families that you support has recently experienced a reduction in funding from the agency, and that's resulted in one of the parents having to leave full-time work. Is that correct?
That's correct, and that's one example. We have many, many examples of where significant reductions in plans with no explanation, and I suppose that's the other challenge is that particularly the ones that we have seen and that come through our organisation, is it's often with no explanation whatsoever. There's been a review of some description and there's been a significant change. And again, going through an NDIS appeals process is a 9 to 12 month process. Yep. And in the meantime, that reduced level of funds remain in place for that person. So it's not an isolated incident, and certainly not an isolated incident in terms of people having to, where they do have family support or are still living at home with family, yes, give up employment.
And so what you're seeing, if I understand you correctly, is Australians with a diagnosed intellectual disability having their plans slashed, and then that meaning basically that their parents have to jump into the gap created by that decision. So in this particular instance, which is a good example, mum didn't work, stayed at home to provide care, and the young person's 22, has level 3 autism, significant intellectual disability, and some physical disability as well. So a person with very limited speech and communication, lifelong disability, obviously, and so a person who's, you would be hoping would be on the beginning of developing their living skills, building their capacity, doing those sorts of things, but a person who's going to need significant support for the duration of their life, probably. Majority of it being provided by family, and a lot of their package was around OT support,
for speech therapy, physio support, and respite for the family. So yes, and that's a quite common occurrence from things that we see.
And what do you think it would mean for families like those if they then had to go through a process of demonstrating the permanence of that intellectual cognitive disability?
Their feedback is how many times do we need to do that?
Yeah.
If a person has, an assessed IQ of 56 at the age of, 16, that's not going to change, and not being limiting in terms of what capacity that young person might develop and what skills they might develop and their ability to do that over their lifetime. But that core functioning is always going to be impaired by having a cognition level of that, besides the diagnosed level 3 autism.
Yeah, it makes sense to me. I can't understand.
Families are exhausted, and for that young man, he ended up spending 6 months on remand in a jail in New South Wales.
The last thing he needs is to have to demonstrate the permanence again to another government process. Yes. Yeah, exactly. Now, to take directly to your submission I'm going to go to the page number of it for you for direct reference. You talk about the issues of, it's page 9, and it's the issues of exploitation in accommodation. And you talk about the supported independent living dynamics that you've observed as being deeply problematic. Now, I just want to be clear here. What it seems like you're telling the committee is a dynamic we've seen a lot over a decade or more, which is you've got a supported independent living provider, somebody that provides you with the support worker, also being the operator or the owner of the accommodation in which the disabled person is living. Maybe SDA, in many states it is, but in New South Wales it's also boarding houses and structures like that. So that's the dynamic you're describing to the committee as being a problem. Your landlord is also your support worker.
Yes.
Yeah.
And your provider and the holder of your plan.
Yes.
Yes.
And so if you decide the fear and the reality for many people, if I understand you correctly, is you may disagree with that provider's provision of service, you might complain about them in the way that they help you shower or go into the community, and then you actually also lose your home. And we see that, you're seeing that play out in New South Wales? Yeah.
Regularly.
So one of the useful things the government could actually do is mandate the structural separation of SIL and accommodation provision. Would that be something that you would support?
Yes, I think that would be, a helpful measure. And I mean, it is difficult because of the housing crisis everywhere and housing options are very limited, and you don't want to limit what might be there, but you don't want to, that to be... The alternatives are a person lives in that environment, they're homeless or they're in jail, pretty much is what happens in New South Wales. So the choices aren't great, and that's why that choice is often, people put up with it for much longer than they should. That's if they're aware
of what's happening to them.
And where we become aware is probably a small percentage of what is actually happening out in the community.
In the system. But it's the case, isn't it, that you could... in many other states where boarding houses aren't as much of a dynamic in the system, you can actually have a provider that does your support work services and then a provider that runs the accommodation.
Yes.
It's hard to build a house, but it's easier to find support workers to come in and help a disabled person. Yeah. Look, thank you so much for your evidence today. I would be very open, and I'd like to take your notice actually, if you could. A couple of additional case studies where you've seen that kind of SDA boarding house SIL dynamic play out, and also a couple of additional examples of what you're seeing right now of removal of supports resulting in parental parents needing to return to the workforce, either permanently or while the 9 to 12 month period plays out. Thank you so much. Thank you.
Now we have Senator Little and then Carol Berry for following.
Thank you.
Over to you.
Thank you. I've kind of really only got one question, but this question kind of relates to thin markets, people where there are multiple vulnerabilities, not just in their lived experience as a person with a disability, but also in the family support structure that sits around them. You know, this, the legislation, the budget talks about misuse and fraud. I'm interested in a conversation that I had with the provider a couple of weeks ago in a completely different place that said most of the people who are on some form, who are on NDIS, have some form of income support that comes from government. The real issue sits in those organisations or those actors who are engaged in either sharp practices or criminal activity of a scale that is quite structured. I'm interested in your perspective on a comment like that, because essentially what they were saying was that's what we really need to focus on if we're talking about the integrity of the NDIS, so that there is more support available to people that really need it.
So do you mean, sorry, so
what I'm trying to
more
understand
focus
is
on
this committee is also interested in understanding how do you actually reduce the amount of fraud or misuse of funds, recognising that there are significant actors out there who are not participants, who sit within that other cohort that I was talking about. How do we actually, or given the commentary was about why not the focus on them, because this provider was saying that's where the biggest issues were. What would you say to that? What's your observation?
In terms of there are providers who are doing a great job, and there are. And I suppose the system also doesn't acknowledge or reward those providers who are doing a great job, who are leading the way in their practice, in their safeguarding, in their processes. That's not acknowledged or rewarded in any way, and not that it should necessarily be promoted, but there's no incentivisation for them to continue to do that. They do that out of their own sense of integrity. So in order to, look at incentivising even knowing who those providers are, I would suggest that the NDIA actually doesn't know who the really good quality providers are. Even knowing that information would be helpful in terms of going, well, what are you doing? What are your practices? How is it working? You're making it work within the scheme. How do we support others to do that? It's not just monitoring where it's not happening and having consequences for that or trying to shut those things down, but how do we make it easier for those providers? Because some of those providers who do amazing jobs really, really struggle. They do things, they get, there was a provider recently I was aware of, some other provider closed down with 24 hours notice, kicked everybody out of their service, said, we're not going to be here in 24 hours. This other provider stepped in, it was in a regional area, and picked up and worked and tried to provide solutions for those people. Quite sure they didn't get paid for doing that. They couldn't claim from anybody's plan for doing that. They did that out of integrity and because it was the right thing to do. So even just knowing who the providers are with good practice, with practice that works, with practice that genuinely supports people to develop their skills and to live the lives that they want and to exercise choice and control, there's no mechanism at all for that to be known anywhere at this point in time. And I think it's a balance of both, seeking out and finding those ones and doing something about the ones who are doing the wrong thing, but also looking at how we elevate and support those who are doing the right thing, and there's an incentive for that to be the preference.
So in terms of you focusing on disability rights, what about the bad actors that are out there? Because I've had people explain to me stuff that is their experience, but when I've said, can you give me some information, they are terrified of those organisations.
Yes.
So how do we protect their ability to be able to engage, to report those things? Because they are terrified.
Yeah. I mean, accessible complaints mechanisms and people being aware of those things, because the other thing is that those providers will make very sure that people are not aware of the options available to them, and exercise an awful lot of control. So again, that monitoring, that checking, that visiting, if being able to go and visit a service and see actually what is happening. But also we are chronically underfunded in advocacy generally, and particularly in individual advocacy, where there's anybody who can walk alongside somebody and actually tell them that what's happening to them is not okay or it's illegal and there is an actual out. But there has to then also be mechanisms, I think, within the agency that if a provider is identified as, being really dreadful and doing the absolute wrong thing, there has to be some additional support for those people who are impacted in that to actually find other things, and that doesn't exist at present either.
Thank you.
Do you want to add anything?
Thank you.
Okay, thank you. And we have a question from Mr. Pike online.
Thank you very much. I've just got one question in relation to your Ability Rights Centre work, particularly in when you appeal NDIA decisions, and take those processes through to the ART. I'm just wondering if you have noticed a trend in terms of matters being forced. Once you've gone through processes with the NDIA, matters being escalated, being forced towards an escalation of the ART. Secondly, when you get there, what's the level of imbalance between the personnel or the resourcing that obviously the NDIA has brought to a matter versus what you're able to bring to the matter? And then finally, if you give us some sort of sense of your rate of success once you get to that point, and maybe if you've got any views as to how that may have changed over time.
You answer the first one, and then I'll do the second.
So I suppose the imbalance when you get there is enormous because the NDIA has barristers and our clients have a non-legal advocate supporting them. In our particular instance, we're lucky because our non-legal advocate is actually a lawyer and has a legal background, but either way, there's still a non-legal advocate. So the imbalance is enormous, and the concerns that we have is the people who don't even have access to an NDIS appeals program like ours. So at present, we've just had to close our intake, and all other services that we're aware of have too. So the demand certainly outstrips what is able to be provided through that, and the funding from the Commonwealth for that NDIS appeals program generally has significantly decreased whilst demand increases enormously. And we've seen almost at least a 50% increase in referrals the last 2 to 3 years for matters going there. We work really hard for matters not to go to hearing if possible, but certainly...
Do you feel, sorry, I'm adding an extra question, but it's a very short one. Do you feel that the approach from the NDIA is to try to force matters into the ART to try to get people to back down?
Yes.
Yeah.
Yep.
Can I just speak to that as well? I mean, so I'm part of the legal service that supports the NDIS Appeals Advocacy team. So most of the time people don't have lawyers, they have an advocate. But even times we say, for example, me personally have represented a client. I've gone to a client's house, they haven't been able to come and access an office. One example, I sat there, I had to build a desk for them to find a computer, to then go on screen to support them. And then we're faced on screen with legal counsel, a lawyer, another lawyer, a paralegal, another paralegal from the NDIA. That imbalance was extraordinary, and it was extraordinary even as a legal representative. The process in the ART is extremely legalistic. It's a process that is daunting for lawyers. Parties have to be cross-examined. It's very paper-heavy. People have to give statements. And what I can reflect upon is an overwhelming majority of people who come to us talk to us about that experience being extremely traumatic for them. They already are facing with significant adversity, and that's another layer of trauma that they have to experience, and it is extremely difficult to navigate.
I'm going to have to leave it there. Thank you very much. I know it's a very sensitive topic, but we have others waiting to step up. So I thank you so much on behalf of the committee for your really passionate and very thoughtful insights. They will help us in our recommendations. If you have taken questions on notice, I think there are a few. The committee requests that information be provided within 2 weeks by Friday the 29th of May. However, if this is challenging, please liaise with the Secretariat regarding the additional time required. And once again, thank you for your attendance. We will now take a very short break and we will return at 2:35. I'd like to welcome both in-person and via video conference representatives from the Illawarra Disability Alliance, the Endeavour Foundation and the Disability Trust. I understand that information on parliamentary privilege and the protection of witnesses giving evidence to parliamentary committees has been provided to you. For the Hansard record, will each of you please state your full name and the capacity in which you appear today? And Ms Musker, would you like to begin?
Sure. Mrs Alicia Musker, the CEO of the Cram Foundation and member for IDA.
Thank you.
Karen Burdett, the CEO of Green Acres Disability Service and a member of IDA.
Taryn Bracken, Deputy CEO of the Disability Trust.
And Rebecca Coombs, Group Chief People Officer for the Disability Trust.
Great, thank you. Now, would you like to make an opening statement?
Sorry, excuse me, Chair. Is it okay?
Apologies.
Yes, I'm just going to declare a conflict with this session, Chair. I was formerly the CEO of one of the providers that will be presenting evidence this afternoon, so I'm going to not participate in this particular session, so I'll rejoin later this afternoon.
Well, thank you very much, Ms Berry, for making that declaration, and thank you.
No problems, thank you.
And online, I should just introduce myself.
Yes,
Andrew
go ahead.
Chesterman.
Thank you.
Andrew Chesterman, Chief Executive Officer of Endeavour Foundation.
Thank you very much for joining us today. Would any organisation like to make just a brief opening statement? Could we start with Illawarra?
Yeah, so thank you so much for that. So just in terms of background, today we're representing 14 members from the Illawarra Disability Alliance that collectively represent over 10,000 people that we support in terms of provision of disability support services, and over 5,000 employees across our group in the Illawarra and Shoalhaven. And we just wanted to express that we really appreciate the opportunity to place on public record the significant and systemic challenges that the obvious threatening of the integrity of the scheme is under, but also to raise the issues around the sustainability of the not-for-profit sector that is so deeply invested in supporting the people within the scheme.
Great, thank you for that. And then Endeavour Foundation, are you wanting to make a comment, an intro statement?
Yes,
no?
Thank you. Just look, we support over 6,500 Australians with intellectual disability in homes, in their communities, in their workplaces. We're the largest employer in Australia of people with intellectual disability, employing over 1,700 people across 28 social enterprises and hosted employer sites. We've made a submission which focuses on two issues which we believe are at the heart of the scheme's integrity, the first being market viability and NDIS pricing, and the second being provider registration and regulation. We are under intense cost pressures. There is sector-wide financial instability. Endeavour Foundation has recorded significant operating deficits for 5 consecutive years, totalling $50 million, and we know we're not alone in this sector. We've drawn on charitable reserves, fundraising, asset sales, and made significant organisational changes. However, it is unsustainable, and frankly, everybody like us are running out of assets to sell. In our submission, we recommended price setting needs to be decoupled from the NDIA cost containment objectives. We wanted differentiated pricing models that rewarded quality and complexity and rebalanced the scale between large providers who invest in quality and compliance and smaller ones who don't. And then on registration, we supported a graduated risk proportionate universal registration model. We've seen that some of that registration discussion has happened as a result of Minister Butler's National Press Club announcements recently, but there are new integrity measures that need to be put in place. So I look forward to the discussion today.
Thank you very much. So before I go to other members, I'll just ask a few questions, just starting with Illawarra Disability Alliance. What do you think is currently working well in the system where the actual current settings are providing some protection to participants within the scheme? We've talked a lot about what isn't, but it's interesting to know is there anything that is working?
I can answer from our perspective is that the scheme is offering amazing opportunity to the people with disability that we support, and we see those benefits every day. The recommendation around moving providers to registration for critical areas of service delivery, we believe is at the heart of the success of the scheme itself, and we believe that there are some really great benefits that come from that registration, the commitment to quality, and so that is actually a very good part of what is operating within the scheme at the moment.
Great, thank you. So conversely to that, what are the key things that you think do need improvement, and have you got any suggestions for how we actually deal with those things in a constructive manner?
Do you want to talk to that with the SGN?
Sure. So I think in light of that, obviously the mandatory registration being rolled out across the board is key and crucial. You can't change what you can't measure, and at the moment, you know, the conversations that you've heard throughout probably the day around non-registered providers, the sharp practices that are occurring quite often, you know, are coming from the non-registered for-profit space. You know, there's constant examples that we could talk to where we are seeing obviously participants that are, you know, at the hands of for-profit people that are literally in the scheme for nothing other than making money, you know, who are relinquishing their services and putting people and pressure on the health system, where you're then having the ethical registered, you know, for-profit providers coming in, trying to obviously assist and take those participants on. So, you know, that registration process across the board and being able to measure that and that audit process is key to, you know, the integrity of the scheme.
Thank you. Just turning to the Endeavour Foundation, your submission addresses provider enrolment and registration, and could you explain your position on how a registration and enrolment system, how it should be designed, and to genuinely improve the system, particularly in regards to fraud?
Thank you for the question. I think it's about having differential. So we are a registered provider, of course, and it's about making sure that registration and pricing rewards quality, particularly quality for complexity. At the moment, the way that the scheme works is that there's an almost it is a universal price, and it's regardless of the quality and complexity supports that you have behind the scheme. And behind the scenes for organisations like ours. So I think, you know, as the earlier speaker said, an independent pricing, registration, pricing that rewards complexity, so that differential pricing. I mean, at the moment, a sole trader, unregistered, with an ABN number and in Queensland just a worker disability screening card and a blue card can get paid the same amount as we get paid to be tube feeding a person in a home during the day. So peg feeding somebody or a sole trader taking somebody out for a coffee, same price, they should be differentiated. And, you know, that, you know, as an example is the sort of thing that, you know, I guess, you know, the quality and the controls that you need to put in place in order to be able to tube feed someone, you have to have systems and processes and policies and safeguarding and all of those things behind the scenes. And I just think there has to be a differentiation for those that can do that and those that can't, and that should be differentiated.
Would that be in the training and skills that that person has, and to have standards of accreditation?
Sorry, I missed the first part of that question.
Should there be standards for the skills that a person delivering those really intimate supports have, and should there be accreditation and wages appropriate to that?
Well, I think there should be, you know, it's a competency-based approach to being able to undertake those activities, particularly those personal activities in someone's home or in a supported home. the differentiation in price should probably reflect the quality systems behind the scenes, not necessarily just the wage that a person receives. We know that it costs Endeavour Foundation around $10 million a year to put in place and have in place the quality systems that in fact are the training and compliance and regulatory activities that we need to have in order to be a registered provider. So I guess that's it's not only just about the wage and the accreditation of an individual, it's about the system behind it.
And I would agree with that. And that's where I think there's been discussion around providers being having a range of providers who are, I suppose, preferred providers who have proven their integrity. Do you see that as being useful?
I do. I think this concept of commissioning, I know that's been talked about for SILs, but I actually think commissioning could go further and into the workplace. There's been very little spoken about in the last few weeks about supported employment. I've just come from one of our supported employment sites, probably over 50 people working there, many of them for some decades. But I think, certainly this concept of commissioning, of proving that you have those systems in place and therefore being on a preferred provider list, if that's what it's called, is a good idea.
Yes, thank you. And then finally, before I pass over to the Deputy Chair, the Disability Trust, you include a case study involving Gemma and an unregistered provider. Could you take the committee through that case study and explain what it tells us about the gaps in the current system?
Yes, most certainly. Thank you for the question, and I will just refer to the case study we provided.
Thank you.
So Gemma was supported through our support coordination service. In addition to the support coordination services she received, she also accessed a range of unregistered providers. During the course of the care of her supports, the processes were not followed, and she had sustained an injury as part of a personal care course of care, falling in the shower, resulting in 4 months in hospitalisation and a complete spinal injury as a result of not using a slip mat. So consequently, that unregistered provider did not need to make a report to the Quality and Safeguards Commission, as would any of us as a registered provider be required to report serious injury. This provider was not required to do that, and therefore there is no investigation around the expected training levels, the expected processes or systems that should be in place when providing that high level of care and high level of personal care to an individual. As such, the Gemma remained in hospital for a period of time, and of course her living arrangements were no longer appropriate for her increased support needs, which occurred as a result of her injury. Also, during this time, whilst she was in hospital, there was also pressure on her family in order to resume services with the unregistered provider, offering a level of service that was not appropriate to her support needs. So our support coordination service had to do quite an extensive amount of support negotiation to support Gemma and her family around making the decisions and choices around what her support needs needed to look like going forward, and which providers they would need to engage in order to make sure that Gemma had those safe, quality supports that really did meet her needs and ensure that she had the appropriately trained staff and the processes behind that. So,
well, thank you for the support that you gave Gemma,
yes.
because obviously it's made a big difference to her and her family.
Yes.
So from that case study, what would you say are the things that government should be doing, or anything that has been done that is going to assist in helping people like Gemma?
Yes. Well, as many people have already mentioned, the requirements for that level of care, we need to have the registration for providers. And what sits behind that registration is being able to demonstrate that they have staff with the appropriate training, that they are audited against the practice standards, that any incidents that do occur or any complaints are reported to the Quality and Safeguards Commission, so that as if required, investigations can occur. And it's important that we listen to the people's experience who are experiencing these situations where things go wrong, and making sure that those providers are not operating in the scheme. They're causing irreversible and catastrophic changes for the person with a disability, and we need to ensure that we have a level of quality across the board.
By registration isn't everything. We've heard that already. However, if it can mean that there's an increased level of scrutiny and reporting that then raises red flags, I would just like to say that majority of providers are doing a very good job. Certainly acknowledge that. But for those that aren't, and they're dealing with people who are very vulnerable, we need to have those red flags. So, it's very useful, your feedback on that. Thank you very much. I'll hand over to the Deputy. Thank you.
Thank you so much. My first question is to the Illawarra Disability Alliance. Your members have identified workers with firearms convictions cleared by the NDIS worker screening check, and when a worker was later charged, the New South Wales Office of the Children's Guardian notifies providers within 8 hours, but the NDIS Commission has taken some 8 weeks for one of your members, according to your submission, and in a more recent case never notified you at all. In your view, what is your understanding, or if you've had any explanation rather than just your view, how does a firearms conviction get past the Commonwealth's main probity check, and have you been given any guidance on why 8 weeks or even silence is coming from the Commonwealth when the New South Wales Government provides the same literally within hours?
Yeah, so I can probably talk to that really well. As at today, I actually have a worker who is still cleared on the screening portal, who on the 16th of April I was provided within a couple of hours of being known that the person had been arrested for an offence that involved a vulnerable child. The Office of the Children's Guardian notified me on the very day that it was also all over media and all over local Facebook groups. As at right now, before I walked in, that person is still sitting with a clearance on the NDIS portal. We obviously had to go through a process of terminating that person's employment, and I'm interested to see how long that person will sit with a clearance on the portal for, when Office of Children's Guardian contacted us the very day. The example of the 8 weeks was within my organisation, and when I followed that up, the only reason we were given was just purely due to the backlog. We've tried as a result of that process to ask questions around what sits in the back end of what you are assessing, because what a lot of providers end up having to do is still have police checks at our expense, because we don't have any understanding of truly what is checked in the back end when someone's going through the screening process. So the person who's currently got a clearance right now could be out working for a for-profit who's not registered, or even going into any other provider, as long as there's no children involved in that service, and could be providing services to vulnerable people when they absolutely should be marked off the the screening portal.
So just so I understand, as a matter of course, you're conducting, or your members are conducting, their own police checks to fact check their NDIS worker screening, because it is it's not reliable.
It's not reliable, and not everyone is, because some people are in such a financial vulnerable place that they can't afford that process, but some still are having to do it because they don't trust that they are getting the information they require.
And is any of the other explanation, are you given any other explanation aside from the fact that we have a backlog?
None whatsoever.
Wow, thank you. That's extraordinary. For the Disability Trust, at our first hearing, the Fraud Fusion Task Force told this committee that the worst sharp practices in the scheme involved providers using items like cigarettes or other inducements to sign up extraordinarily vulnerable participants and then banking the rest of the plan. Your submission names a young man, Daniel, an Aboriginal man with acquired brain injury on a plan with a value of over $1 million, and that he was approached by a competing provider that promised to fund cigarettes and allow family members to have the overnight stays in his accommodation. And then once he signed, the provider said, "Oh no, your family can't do it." And then it was actually terminated, I believe, that plan, or my understanding was in reading that. Do you have any insight in this particular example or others like it, how much, say, of Daniel's plan was actually delivered as a service after that switch, and was this provider reported to the NDIS Commission, and do you know what the results were? I'm trying to get an idea of how much of these participants' plans are actually, for want of a better description, and I think it's probably accurate, stolen by these providers, and then what they are left with.
Yeah, so just to clarify, his plan continued with that new provider.
Oh, it did? Okay.
It terminated services with our organisation.
So they terminated with you, he terminated with you, but stayed with them even though what they told him wasn't true.
So he was encouraged to change providers. And of course, people absolutely have the choice to change providers at any time. However, as you've described, the practices to convince him to go and seek services elsewhere were very questionable, and then they did not support him to have family members stay in the setting as per the promise. So the service continued in that other provider. For us as a provider, we can provide the reports, we can provide a complaint to the Quality Safeguards Commission. We don't get any feedback around what action may be taken in relation to the other provider. There's no outcome reported back to the person making the report necessarily. And as far as we're aware, that person now is in a vulnerable situation, in our opinion, in a service that is of less quality and has ulterior motives or not the right focus around providing him with quality support. So that's a big concern for us, particularly for vulnerable members in our community.
And there's no other avenue for you but to report that to Quality and Safeguards, and
that's right.
They do what they do.
Yeah, so at that point he chooses to cease services with us as a provider, whilst wherever possible we might make reports or complaints, but at that point he's chosen to disengage from us. So whilst we try to work within the sector and provide education or guidance potentially to other providers that we're working with, we have no oversight or no further course of action around moving providers.
How prolific do you think these types of inducements are, or how often do you see them?
Yes, so I don't know how prolific it is across the whole sector. I can only talk to what certainly our services see, but it is frequent. We have a number of examples of these cases where people are encouraged to go across with either purchases of iPads or cigarettes or things like that. Providers are encouraging people to come across, and then they strip out the person's plan for services that are not actually provided. And where possible, we either have intermediaries such as support coordination services, or in some cases plan management services, trying to support the person with disability to perhaps make a different decision or get additional support in relation to the provider. But that can be very complex, and it's often unfunded work, work that the quality ethical provider is not funded to do.
Thank you. Your submission also talks about plan managers and support coordinators directly telling participants to leave a person in a hospital. That plan managers are being told by the NDIA to leave people in a hospital to trigger a funding review. So this is a mechanism that the NDIA are using themselves in order to short-circuit a process to that review. and then you also document a case where a participant who needed a hoist for a new home was refused. So the NDIS has said, because you're refused, go to the hospital, and then when you're in the hospital, it'll trigger the assessment and then you'll get the hoist, right? Can you explain to us why that is happening and what are the gaps in the scheme that are causing this to occur, and how this is, and do you have anything, in writing, or is this all verbally provided to clients? How do we document and prove this in order to stop it from continuing and actually create a proper pathway where participants don't feel that they need to go into a hospital to actually get the assessment that they need? Much unfortunately, like aged care, we're seeing people sitting in those hospital beds in order to get assessments and placements as well.
Yes, absolutely. That example spoke to one of the challenges that providers are experiencing as a result of funding periods being implemented. So whilst we completely understand the intention of funding periods to pace out the spend of a plan over a period of time, what it has done is created difficulties for participants to purchase the supports that they need in the timely manner that they did. So that example was that the person wasn't able to, because the funding was petered out over the funding periods, they did not have access to the full amount of funding to purchase their hoist, which was an essential piece of equipment to continue their support needs. And when the attempt was made to try and negotiate that, the recommendation was, well, perhaps that person needs to go to hospital because the existing situation just didn't have the equipment to support them. So it's happening more and more. The review process for people when they either receive a new plan or have their change of circumstances, their circumstances change and they require a different plan to meet their needs. The process for that is lengthy. It stays in the applications and the evidence is provided, and that can be quite a period of time before that plan is processed or that plan review is processed.
In the hospital, it's immediate.
The hospital assists because we then have the advocacy of the hospital and the state-based health system helping to advocate around those bed blocks to try and progress
they want
those
them out of the bed.
That's right, of course they do.
Yeah.
There's pressure on our hospital systems, so we can't be having people who are not medically unwell in hospital.
Yeah.
So
if you're languishing at home with your needs not being met, there's nobody that's going to advocate for you in the same way that a hospital's going to advocate to get you out of their bed.
That's right.
If you don't mind just us adding to that from the Disability Alliance perspective too, that's a perfect example of the downstream impact of what's happening with that administrative issue that's going on within the scheme itself. And it gets to the core of where the actual scheme integrity is really around its design, and the fact that many providers, unless it gets to that issue, don't have an avenue to properly advocate for serious and urgent issues. And I think what we're all very frightened about is that with the recent proposed announcements for the change within the scheme in terms of even decreasing again the ability to put forward a plan review, it's actually going to get worse. And so then what you've already got at the moment is registered providers that have a commitment to the actual participants already providing those services without any funding source. And that's actually going to be a constant drain on those service providers ongoing and just increase over time.
If you could just ask.
If I could add.
Yeah. Yes, of course.
Yeah, we have, I'll give you another very brief case study. I have a 59-year-old male with an acquired brain injury, scoliosis and epilepsy. He's non-verbal and navigates life in a wheelchair with his formal supports. He obviously has an extreme impact on his daily functioning, and he's entirely dependent on the NDIS supports for all facets of his life, including eating, toileting, washing and accessing his community. His funding does not cover the needs, and we estimate his funding is several hundreds of thousands of dollars short from his actual needs. We've had several attempts to have that NDIS funding reviewed with little success. So in the meantime, it is Endeavour Foundation as a charity that does the right thing as a quality provider with all of the safeguarding processes behind it, and we've foot the bill. And I've got other examples where I've got an individual in a home who can only live on her own because of her severe behavioural challenges. She has a severe intellectual disability. She's funded at a ratio of 1:3. We know we have many reports that support, formal reports that support that funding is inadequate, but we have to staff and maintain resources in that house for money that we don't receive because it's a 1:3 ratio.
And I do apologise because I understand, again, this is a very sensitive topic, and these particular, these people, we are all very sensitive to the fact that there is challenges there. It would be of value to work with you separately on those two cases and speak via the Secretariat to the NDIA to just discuss what. Often we will have an officer here, but I don't think there is one here. No. So under these circumstances, we can follow up on that separately. But just in the interest of time, we will move on, and I'd ask Ms Brown to ask her questions.
Thank you, Chair. I'll just go to Illawarra Disability Alliance. In your and please, anyone on the panel. I just want to go to in your submission around your view that you've got here significantly enhanced the Quality and Safeguarding Commission's publicly accessible real-time provider compliance register. Can you just talk us through exactly what you currently see and what you would like to see?
I think the challenge that we have is that, and we were just discussing this today, is that detail around what a provider actually does go through in terms of its registration and even being registered, its level of registration is often not easily accessible and relies on providers or a participant contacting that particular provider to find out the exact nature of their registration. And a certain circumstance that we were just recently experiencing is the case where somebody with very complex disability and having restrictive practices as part of their behaviour support plan being supported in a SDA supported independent living environment where technically the SIL provider was registered but not registered for the ability to administer restrictive practice. And effectively what came out of that was that the support coordinator that was trying to go down the pathway of actually understanding that and get to the root of the issue, had no real way to actually detect that. And so by having a register that clearly talks about what are the levels of registration and certification that you have under that particular, specific type of registration is really critical for participants and families to know what they're getting. But I think from a quality perspective, it's a broader ecosystem as well, because it's about making sure that people are educated in how they can advocate for themselves in even asking that. And like listening to some of these challenges, it's not just one thing, it's not just a register, it's the layers that go into keeping people safe. And that's self-advocacy.
To the integrity of
it does. It does.
And I think to add to that, the compliance register that lists providers that have concerns against them doesn't often have a lot of detail.
No.
So it will list the particular piece of legislation that there might have been a breach. But for the average person who wants to go on and look up the provider to see if there's been any compliance action, that's very confusing. There's not a lot of detail available.
Okay. And does Endeavour have a view?
I wouldn't add any more to what's just been said in the interest of time. Thank you.
Okay. So I will. Do you? I'm particularly interested in how we go forward in terms of payment system and the claims systems overhaul. And there's some information that's been put out there by the federal government. Do you have a view of that direction? And if you can share it with us, share it with the committee, or do you think you'd like to add to it? Or
the only thing that, from the Disability Alliance's perspective, that we would add is that the urgency around the digital visibility of who payments are going to, we feel will be game-changing in terms of the scheme sustainability, because you will actually get visibility over where these payments are going to, and be able to identify what's actually going on. The only thing that we would say in terms of the importance of that is being very mindful that providers, and particularly the ones that we represent as part of our alliance, have multiple layers of change occurring at the one time, and that's not just within the scheme itself, but industrially and also state-based requirements as well. And so we would be saying that in terms of any system-based implementation or change, that lots of consultation goes on with the actual providers that are having to administer it. We see it time and again with the scheme that consultation is either fast-tracked or not given broadly enough, and then we find ourselves in really debilitating situations that actually cost the scheme more money to fix.
I would add to that, I would just urge the agency to really listen to the feedback. Providers have given the feedback on what works and what doesn't work, and when those systems are not working, it makes it extremely difficult. There is a lot of administrative burden and churn for providers that ultimately impact on the services that they're able to provide to people with disabilities. Providers are willing to work with the agency around finding solutions, but they need to listen to the feedback that the sector is giving them.
one of the pieces of evidence we've heard here today was the need for a first step around whether a service is actually in scope in your plan. So you're able to ask, is this something I can claim under my plan before you actually, get the service, you actually engage the service.
Yes.
And it's that issue that often causes, invoices that have been put in and then cancelled and,
Yes. So
all hell breaks loose.
Yes, so that's speaking to the service bookings situation that previously did exist and has been disbanded.
Yeah.
So previously service bookings would occur where the person with disability would go to a provider and say, this is how much is in my plan, I want to spend this much with you and this much with you and this much over here. Yeah. And the service provider would essentially book out that money. They wouldn't take it all at once, but they would sort of reserve it and book it as the services occurred. So that has been removed, and which has now resulted in people billing from the plan without visibility of how much has been booked out. So we've had examples where people come to us to request services. We provide that in good faith. The person also believes they have the funding available. We go to provide the service or go to bill for the service. It's declined. Another provider has billed from that plan or that category.
And you actually see quite a bit of sharp practice coming from non-reputable providers, where it's almost now, because nobody has visibility of what's going on, it's almost like a race to sign on in terms of where they will circumvent going through normal channels, through providers and support coordinators and plan managers, direct to families. They know there's limited funds, they get service agreements signed, and that's then locked in the hope that they're then going to be able to claim first, if you will, because of something that's been signed, even though they know that there's funding that's not necessarily available. So that sort of change in the system has inordinately created another flow-on problem with the fix that was implemented.
So what can we do? What should we do?
Consult. Yeah, lots of feedback.
Well, we're here.
Yes, and we sincerely appreciate
And I
it.
think providers understand we need to move towards a point of sustainability.
Absolutely.
We understand that. We understand that the scheme needs to make sure people don't overspend on their plans. But if the opportunity exists, we need to listen to the providers around how we can get a balance.
But you're essentially saying some of this overspending is, done in good faith because there's not enough visibility.
That's right.
Okay, thank you.
Thank
Over to you, Senator Stiljohn.
Thank you very much, Chair. Now, because of the lack of checks and balances that this government has placed on service providers, it's clear to me that providers are responsible for the majority of fraud in the NDIS, and that's what the evidence is bearing out to us. So first of all, and this is for each of your organisations in turn, do you have a measure of the rate of fraud within each of your organisations? Are you confident that the conflict of interest processes and the anti-fraud processes that you may have are 100% watertight? And if not, what do you need to be able to reduce fraud in your organisations to zero?
I'm happy to offer that first. Look, I think we would absolutely have a zero tolerance expectation of any fraudulent billing in our organisation from the Disability Trust. So we have a number of systems in place that double check that the services have been provided once that they're billed. We also undergo frequent checks from the agency to double check. We will on a monthly basis get a number of claims that we have made. For a double check, we need to provide additional evidence around that service that has been provided. So for us as a registered provider, we actually have a number of systems and external checks and audits to double check that our billing is accurate and not fraudulent. In terms of the conflict of interest, we also have a number of systems in place where we ensure that there is transparency around. We provide a number of services, so in some circumstances people might choose to get a number of services from us as the one agency, and they have the opportunity to understand all of their options and make the decision around where they choose to get their services.
So just to clarify, at best what we're looking at is monthly reviews, no immediate checks.
I will need to take that question on notice.
Yes, please.
If any of those claims are immediately flagged for checked.
For fraud.
For checks,
Yep.
yes. Yes, I do understand there is quite a bit of evidence that does need to be provided, but
Yep.
I'll double check that.
Yes, please. And so with your conflict of interest processes, are you confident that they are 100% watertight?
We are always working towards improvement and bettering our service. So where there are opportunities, we will work with the people who use our service to say, this is what we've currently got, what else can we do? That is part of our continuous improvement at all times.
Okay,
Yeah.
thank you.
Yeah, so I would echo in terms of the zero tolerance. I think from Greenacre's perspective specifically, we have embarked very recently over the last 12 months on some significant investment in terms of a dedicated NDIS support team that actually looks at our own processes. I think that it would be folly for every provider and any provider to say that what they do is with 100% accuracy at all times, and I think given the complexity of the scheme and the administration that we operate under, that's always a major challenge. But what I would say to the conflict of interest side of things is specifically for us, we work heavily in terms of trying to educate participants and families on their right to challenge. We obviously have policies in place and there are active conversations that take place with that with participant and carer reference groups having employees attend our board meetings to talk to issues firsthand, and then a range of other meetings and actions so that people's voice can be heard if they do have a challenge. That said, what I'd like to just do is highlight the importance of alliances like the IDA. We commit as a group of service providers that within the boundaries, obviously, of privacy and all of those legislative requirements, that we uphold that. But we are also a very good example of how we operate to sense check when things are not going well. And I think that groups like ours actually operate to enhance that ability for quality and also stopping things where there is conflicts of interest happening when we can see things, because in an Illawarra as a regional area, we have a lot of people that are using the same providers across services, and that commitment to quality that we all have does help to flag if there are any issues that we're seeing amongst each other's service provision.
Thank you. Endeavour.
Yes, thank you. I'd probably echo a similar sentiment around zero tolerance. Is every bill we send out always 100% accurate? Well, with 6,500 clients in some form in Endeavour Foundation, I'd say we're always working towards improving those systems. We do have a pretty robust conflict of interest process, both internally but also between support coordination and our services. So we are very cognizant of being transparent about that relationship between where we might be in the support coordination role and offering services as well. We do have an internal audit function with a third party undertaking many of those internal audits. So we have what I would say is a robust and risk-assessed internal governance process, as any large organisation should have in place. And I would also say that we have self-advocacy groups, we have client advisory groups, and of course we have a board that also has a very close eye on what is a highly regulated charity.
Well, I think all of us here, certainly all of us in the Australian community, would have a desire and a hope for a zero tolerance approach to fraud would be the view. But here we are, and as a committee, we have an expectation, certainly I have an expectation, that zero fraud would be occurring, and that's what you would be able to confidently state to us as the recipients of Australian public funds and the managers of those funds on behalf of disabled people. None of you have been able to do that today. I'd like you to be able to provide me on notice the anti-fraud frameworks that you have within your organisations and fraud control measures that you operate, as well as your conflict of interest protocols. Endeavour, you also mentioned an external auditor, so if we can have the name of that external auditor, that would be useful to the committee. And I'll end with the Illawarra Disability Alliance. You have been at least, I think, quite vocal about your concern in relation to the government's announced NDIS changes. In concluding here, is there anything you'd like to share in relation to those concerns with us as a committee today?
I think what we would do is say that we do support some of those changes in regards to strengthening quality service provision through registration. We also actively support the focus that is on decreasing fraud within the scheme and giving greater visibility around the systems and processes. That said, we're deeply concerned around some of the quite deep changes to the social and community community participation funding. We understand about trying to rein in the cost of the scheme, absolutely, but we don't want to see inadvertent flow-on changes that come as a result of that particular bucket of funding, where people with supports for employment are also caught up in that particular category, and where we actually have the flow-on impact of reductions in that particular area of funding, then leading to other challenges where family members and loved ones cannot then work, and we've got people languishing at home and not having the right to actually access their community, which is extremely important. And so I don't know if you would want to add any other piece, Alicia, from your perspective.
Because we are running over time.
Sure. No, that's fine. Look, I don't think there's anything massively that I would add further that you haven't already covered, Karen.
Okay.
Okay, thank you. Thanks, Chair.
Thank you very much for your time today. Very informative and constructive contribution, and we thank you for that. So if there are any questions or requests for further information, if you could provide that information to the Secretariat by Friday, May 29. However, if there is challenges regarding that, please liaise with the Secretariat if you need additional time. And so once again, we thank you all for your contribution and time today. Thank you.
Thank you.
Thank you.
I also would just like to thank National Disability Services for your patience. I know we're running a bit behind, and I'd like to welcome you to step forward. Well, good afternoon, and thanks for being with us today. I'd like to just provide some information on parliamentary privilege and the protection of witnesses giving evidence to parliamentary committees. I think that you've been provided with that information. For the Hansard record, if you could each state your full name and the capacity in which you appear today.
Michael Prusco, CEO, National Disability Services.
Karen Stays, Director of Policy and Advocacy, National Disability Services.
Thank you. So would you like to make a short statement?
We would, yeah. Thank you, Chair.
Continue.
Okay. So thank you very much for the opportunity to appear today. National Disability Service is the national peak body for quality disability providers. We support strong action to improve integrity in the NDIS. Fraud and sharp practices cause real harm to participants and families, undermine trust, and disadvantage providers who do the right thing. Our core message is that integrity risks in the NDIS are systemic, not isolated. They've emerged in a system with limited visibility, uneven regulation, and incentives that do not consistently reward quality and compliance, not just from individual misconduct. Since our submission, the government has handed down the budget and introduced legislation that makes the direction of reform very clear. The intention to return the scheme to its original purpose, supporting people with significant and lifelong disability in a sustainable way, is clear. We support that intention and note that this comes with a heavy responsibility to get it right. We also note the proposed strengthened focus on market oversight, including expanded registration, enrolment, and a digital payment system. We are very pleased to see this reflected in the reform agenda. It is a step that will undoubtedly lead to improved safety and assurance for participants and increased quality of the support provided. What has been signalled alongside this is a significant contraction of the scheme, tighter access, reassessments, and a very significant reduction in funding for social and community participation. This is unprecedented reform in both scale and complexity and means implementation is critical. People with significant and lifelong disability must receive the supports they need. No more and no less. That is the promise of the NDIS. It also requires a stable, quality provider market. Quality providers are making real-time decisions today about workforce, services and viability in response to the announcements that have been made over the past 2 weeks. Many have been the glue holding the system together, supporting people through gaps and system complexity. If quality providers with the capability to support people with complex needs become unviable and exit, the consequences for participants and for the integrity of the scheme will be devastating. Integrity cannot be achieved through enforcement alone. It requires system settings with the right incentives, including pricing to shape the market we need and that make it clear and workable to get it right and harder to get it wrong. We're very keen to work with government on the detail and implementation of the reforms to ensure a sustainable and effective NDIS, and we look forward to your questions.
Thank you very much. Did you want to add anything?
I did not, no. Thank you. I do not.
Thank you. So I'll just begin with a couple of questions before handing over to the Deputy. Now, in your submission, you addressed the payment reform system, or the system reform. What special changes do you consider necessary and why?
Could you be a little bit more specific about what the area you're referring to in the submission?
So I'm referring around the payment systems. So
okay.
Yeah,
Yep.
sorry, and
Yep.
the need to make them, I suppose, have more checks and balances around them. And it's also, I think, that ease of being able to use the system and to actually help those filling in those online forms that they're doing the right thing and they're doing it the right way.
Look, I think it's fair to say the systems in the agency and the commission are not mature and certainly could be improved. We were very encouraged that the government allowed a significant investment to be made in the digital payment system in the budget this week. That is a really important step forward and is one that is overdue. I think coupled with that, we were, as Karen said, really encouraged to see some of the guardrails being put in, well, a commitment to put the guardrails in that are also badly needed in the scheme.
What sort of guardrails
So I think what's proposed in terms of the registration and enrolment of providers was very, very welcome. I think that at the moment you can only see really 6% of the market, and that is a situation that had to stop.
So why is it important that we see visibility of everyone who's actually taking part in the scheme in terms of support and services?
So providers, visibility of providers, So in order to get value for money out of the scheme and in order for government to ensure they have the providers that they need to deliver services and for participants to have confidence in providers, there needs to be visibility of who's providing the services. If you don't know who's providing the service, then it is very difficult to know whether you are getting what you need out of the scheme and whether people, from a government perspective, but whether people with disability are getting what they need out of the scheme. So that the first steps that were announced, well, firstly at the Press Club and then this week in the budget, as I said, badly needed and overdue.
Did you want to add anything, Ms. Stace?
Yeah, I was just going to say, I think the other reason that's important is we believe having visibility over more of the market enables a more proactive response. It enables trends to be picked up earlier, risks to be identified earlier. It also enables education efforts to be directed where they're needed. It's very difficult to do that if you're not sure exactly who's doing what.
Yes.
So we think that it's a proactive and an early identification mechanism as well.
I think that's an interesting point you make about innovation. Perhaps it's something that the scheme has not done as well as it could in the past. And are you aware of any of those innovations that are currently occurring?
I think one of the challenges at the moment is the quality provider market that you would expect or want that innovation to come from is under such immense financial pressure that the focus is on viability at the expense of innovation.
And do you think if these changes are put in place in relation to registration, enrolment, preferred providers, this type of thing, do you think it will actually help those quality providers to actually do their job better?
So I think it'll undoubtedly improve the situation. We need to see a lot more detail to understand exactly what the impact will be.
Fair enough. So in relation to information sharing, what are the current barriers and what would better information sharing between regulators, agencies and providers, what would it enable, do you think?
So we think that it really is about using the data that's gathered and using that in a coordinated way. We would like to see those pieces of data joined up. Yeah. And as I said before, I think it is about being able to identify trends early. It also supports identifying good practice. I think one of the earlier witnesses was talking about when providers are innovating and are doing really good things, it's difficult to identify that and to actually learn from that across the sector. So I think that data sharing, a much more coordinated approach would be really helpful. The other thing that we think is really important about a coordinated approach and better communication and data sharing is some of that early identification. So where are there issues in the market and what sort of intervention might be able to be done before people's supports are disrupted, for example. So we think that that's another really important piece that could be achieved, through clearer accountabilities across the system, through better data sharing, through better coordination.
Yeah, thank you. I just have one final question. You raise regulatory alignment, and you talk about whistleblower protections. I'd be interested to hear from you more about why you think stronger whistleblower protections are necessary to deliver, better outcomes for the scheme, and also, I suppose, the benefits could flow from it, and if there's anything you want to say about how we incorporate that better into the scheme.
Yeah, I mean, I think, whistleblower protections are incredibly important, and disability service providers are, support integrity measures. They're, invested in having bad actors, surfaced and having action taken against them, and whistleblower protections that enable people to, make complaints, raise issues confidently without fear of any recriminations are an incredibly important part of that early identification, noticing when things aren't working as well as they could, picking up those areas where we do have bad actors, not acting with the best of intentions and not acting with integrity.
So how do we incorporate, how do we do it better so people feel confident that they can step forward?
Yeah, I think, really, I think there's kind of clear guidelines that are needed. I mean, one of the things that I think can get confusing is knowing exactly where to escalate an issue, who is actually responsible for dealing with that issue. I think that would be really important. For providers, I think it's about, they do have confidence and they absolutely do report to the NDIS Commission, for example, when they see things that do need to be reported.
And I've actually spoken to providers who've done that.
Yes, yeah. And I think being able to do that in a, in a spirit of, we're here to improve the scheme, we're here to safeguard participants, we're here to make this scheme as good as it possibly can be. I think in that sort of partnership and a collaborative way makes a difference.
Well, I think perhaps there is an opening there for providers to be consulted on how it is done and provide a set of guidelines that actually help someone who's in a position where they've seen something and they really feel that they need to report it and that there is a safe passage for them to do that. So thank you very much, and I'll hand over now to the Deputy.
Thank you for your time today. Page 9 of your submission talks about pricing to support integrity, it has to be independent, transparent and evidence-based. The government's reform placed pricing responsibility with the Minister himself, who also carries responsibility for the scheme's cost containment objectives. What does the NDS need to see the Minister put in place to ensure that pricing decisions genuinely meet that independence and transparency test that your submission sets, particularly given there are budgetary pressures? So what can this committee recommend to ensure that they are two separate things, and particularly the obligation for a minister in relation to budgetary responsibilities doesn't feed into that independence and transparency of the price setting?
I might make a couple of just general comments. The position that we put in our submission was that pricing should transfer to the independent IHACPA, and we said that because pricing in the health system in aged care is done independently, and I would argue that in disability it's actually more complex, given the really you're looking at individual packages with very different packages across the 700 participants.
So just so I'm clear from the outset, so your view is that it shouldn't sit with the Minister, so that even though these reforms suggest it, you believe it should be independent?
I think going to the Minister is a good step. I think that, and it's an important first step. I think the Minister receiving advice from the agency, the department, and in some of the advice yesterday, it was also seeking independent advice. We think that is a good thing. We think that pricing is a very important tool in driving the provider market that you want and the quality of the provider market that you want. And in order for that to occur, you need to have a very sophisticated approach and avoid unintended consequences.
Which we have a lot of at the moment.
We do. And look, the one-size-fits-all approach to pricing is driving a lot of problems at the moment. It's driving our members broke, and it does mean that the wrong providers are thriving. So having the Minister now being responsible, as I said, it is an important first step, but ultimately we would like to see it in IHACPA.
Okay, so it's better for it to be with the Minister than where it is now, but you don't think it should land with the Minister ongoing, it should be...
We certainly would prefer to see it ultimately with IHACPA, and we think that it is very important that we introduce differentiated pricing as quickly as possible in order to stabilise the quality provider market who are doing the work with people with the most complex support needs.
So if it stays with the Minister for a period of time and doesn't go to IHACPA, what do you think that the Minister needs to do, and what should we recommend to ensure that independence?
I think it is important to understand the context in which the services are being provided, and what I mean by that is providing services in the NDIS is actually very different to the health system, the Medicare system, or the aged care system. It comes with a requirement for a level of specialist expertise, but also the level of admin and engagement with both the Commission and the agency. And that needs to be built into the price, along with the various compliance obligations. And as I said, a recognition that providing services in this scheme is very different to providing services in other systems, particularly for those with the most complex support needs, and that needs to be taken into account in the pricing. And I think the advice that the Minister receives, we would certainly encourage the Minister to seek advice beyond both the agency and the department, and see that independent advice is really important.
Thank you. In your submission, you talk a bit about uneven regulatory settings. Could you elaborate a bit more for us about how they are uneven and why you believe they've become uneven, and again, what we can do or what we can recommend to fix that?
Look, I think the main element of the disparity is the registered versus unregistered providers in the market, and the level of regulation on registered providers and the complete lack of the unregistered market. There is a significant cost differential in being registered, and that needs to be reflected in the price. But in terms of the reforms that have been announced in the last couple of weeks, I think what we've been pleased to see is a recognition that if you are doing high-risk, complex work, then you do need to be registered. And if you are providing services in the NDIS, you need to be enrolled. And that is a very positive development.
So that sort of leads into my next question. So there's a lot of feedback about small operators, independent businesses, and they don't need to be like a care business of some kind, like, you know, providing mowing or cleaning. Could well be the local regional physiotherapist or speech pathologist who only may have 1 or 2 clients on the NDIS and who serve that local community, and there is no one else there.
Yeah.
Registration for them is prohibitive, so if we take them out and they have their own registrations in terms of their professional qualifications, how do we manage something like that in terms of that enrolment piece, or do we have a separate group of registrations for individuals who are qualified practitioners so that we actually don't lose them in thin markets and force people with disabilities to go to to large centres or lose the services that they're very happy receiving at the moment?
Yeah, so we have been advocating for a risk proportionate regulatory system. Often what we talk about is registration, but not as we know it now, that we do have a fairly one-size-fits-all registration system that doesn't necessarily account for the variety that you've just spoken about, variety in complexity, in provider size, in their market, in who they're supporting. So we think that it needs to be a proportionate system. There is definitely room for mutual recognition of somebody else, of a professional's professional registration, for example. We think that those things are really important to build into an appropriate regulatory framework. We do think that there needs to be a level of oversight, and that can be on a continuum where it may be a very simple matter of providing some details and some base level safeguarding requirements, potentially committing to the code of conduct, all the way through to much more rigorous compliance where, the risks are higher, the organisations are larger, they're working with more people with disability or with participants. So I think that's one of the ways of addressing the issues that you've just spoken about.
But I would just add to that
If we could be quick.
okay,
Sorry.
like every other scheme in the world, every other government program in the world, the providers delivering the service should be visible and they should be accountable. That's our point.
Yeah, thank you for that point, and thank you. Interesting discussion, and thank you, Miss Berry, for waiting so patiently on the line. Over to you. Are you muted? Can we hear you? I think, are you on mute? I'm not sure. What we might do, you can hear us? But we can't hear you, I don't think.
Okay.
Here you are. You're online.
Right.
Good to hear your voice, Miss Berry.
Okay.
Over to you.
Thank you. So thank you for your submission. Noting your point that, of course, approximately 94% of NDIS providers are unregistered. You talk about in your submission that non-compliance in the NDIS, including fraud and sharp practices, is real and systemic. That is quite a strong statement. You also talk about that you believe that the current market is very complex. You talk about where integrity settings remain reactive and where significant parts of the provider market operate outside consistent oversight. Can you further elaborate? And you've certainly given your evidence has tended in this direction anyway, but can you talk to us about how you think integrity settings could be more proactive beyond registration, which is of course a big component of that, I imagine. Is there any other observations you'd like to make about how the oversight of the sector could be more proactive and less reactive?
I'll make a couple of comments. I can't avoid making the first point, which is you need visibility. That's given. I think once you do have visibility, the payments that are the payment records are absolutely critical, and more broadly than that, the data that is available across the Commission, the agency, and to a lesser extent the department needs to be used much more effectively. I think we're in a situation where has she no.
Sorry, I'm not sure why it keeps kicking me off, but I am here.
No worries. I have lost my train of thought. Do you want to pick me up?
I think you were just saying about payment systems.
Yes. Look, I think payment systems are an absolutely critical piece, and that's why we were so pleased to see the investment. I think it is important, though, to note that investment is going to take, that system is going to take some years to roll out, and we need to be conscious of what needs to be done in the interim. I think the other really important integrity piece is stabilising the quality provider market and paying particular attention to this transition period where there are a lot of moving parts, many of which are going to flow through to providers. And I think over the next 2 to 3 years, it's going to get harder for quality providers rather than easier. And that's, that's coming at the same time that they're already experiencing financial pressure. And I think if you lose that capability from the market, that is an integrity issue in of itself. And we really need to keep a watch on that, and we really need to ensure that where we're seeing trouble, where issues are emerging, that we're getting that data and we're acting on it, or government is acting on it. You want to add?
I think that's fine.
Thank you.
Okay, thank you very much, Ms Berry. Over to you, Senator Steele-John.
Thank you very much, Chair, and thank you for your evidence this afternoon so far. I guess I want to start with a fundamental baseline question. Providers, and you represent providers, make significant profit from fraud. That's part of why we are here today doing this inquiry, is that fraud is a reality, and the primary driver of fraud in the NDIS are providers. So where is the motivation, in your view, for providers to tighten their fraud controls?
So the first thing I'd say is that the scheme has been set up in a way that has enabled fraud and misuse and exploitation of participants and the entry of providers with very poor intent. And I'm very pleased, we're very pleased that that is going to be addressed through the reforms. And the caveat is we need to see more of the detail. In relation to the providers that we're talking on behalf of today, our membership are quality providers. They are committed to providing high quality services, and I think the other point is that they are part of the small group of providers that we can currently see. Our members open themselves up to audit. They self-report to the Commission. When they find issues, they work through and make sure they don't happen again and that they're addressed. The large part of the other part of the market and what's going on in that is completely unknown. And I think that goes to the question you're asking. I think the level of fraud and misuse of funds and exploitation in that part of the market is not something we understand because that part of the market isn't visible.
Okay, so what you seem to be implying there is that you are you're 100% confident that there is watertight fraud prevention processes in your members' organisation. There's no fraud being committed by NDS members.
Look, I don't have the information or the data to answer that responsibly. What I'm saying is that I am very confident in saying to you that our members are committed to providing high quality services, that they are committed to fraud not occurring, and should it occur in exceptional circumstances, they would do everything in their power to stop it from occurring again and rectify that situation. The intent of our membership is very different to the intent of the part of the market I think that you're referring to. It is easy to make a buck in the NDIS at the moment. It is easy to exploit participants in the NDIS at the moment, and that is something that needs to change. At the moment, we are relying on the goodwill of quality providers to prop up a scheme that doesn't have the appropriate guardrails. Thankfully, the reforms that we've seen introduced in the past couple of weeks go some way to addressing that, and that's why we're so pleased that the government has moved on it.
And yet, I mean, I hear from you the phrases around quality provider and your statements around the quote part of the market you can't see.
Yep.
And yet, the vast majority of provider fraud that occurs is committed by registered providers. And we heard today, before you gave evidence,
yep,
that there are horrendous practices undertaken by registered providers. So I hear that from you, but that comes within the context of a inquiry which is hearing very conclusively that where fraud exists, it is provider fraud. Of the overall number of provider fraud that we know of, that is actually, convicted and prosecuted and established, it is registered providers that have engaged in those fraudulent activities. And we've got poor governance at a agency level, but nothing in what you're saying absolves your members of their role in fraud within this scheme. And I'm quite I'm quite frustrated, quite frankly, that we are engaging in a conversation about this that doesn't often enough make clear that fraud is a provider problem, not a participant problem.
I couldn't be clearer. I agree with you. Fraud is a provider problem. The way the scheme has been set up has enabled it. It has incentivised it. My point is that our 1,000 members of the 16,000 registered NDIS providers and of the 300,000 odd providers more broadly, I feel very confident in saying to you that they are quality providers who are committed to providing the best quality support to people with disability. It doesn't mean that things always go right. This work is too complex for that, but what it does mean is that when it is identified, they will move heaven and earth to address it and stop it from happening again. When I talk about quality providers, what I'm referring to is organisations with independent governance, with the intent that I talked about, obviously registered, with the systems in place that people can speak up, so employees can raise alarm, participants can raise alarm. They open their organisations up to external audits. They have quality systems and practice governance systems, and they invest in their workforce. And they do all this for the same price that a sole trader gets. And that's why they're going broke. And it's why that I'm very concerned that it's this part of the market that is at risk. And if we lose this part of the market, then that is going to be devastating for the sustainability of the scheme, but also for the outcome of participants.
Do you have a final question?
No, I'll leave it there, Chair.
Great, thank you. Can I just say, I think that your point about good providers and ensuring we create a system that actually supports providers to do the right thing is very essential. And I think I'm hoping that the changes that are now starting to kick in are going to make a difference to that. Yes. Yeah. So look, on that note, I would like to thank you for your time today and for your submission. And if you have taken any questions on notice, if you could please respond to those by Friday 29 of June. Oh, sorry, May. Been a bit overly generous there. But if you do need more time, if you can just liaise with the Secretariat. Thank you so much for your time today.
Thank you, Chair. Thank you, members.
And then finally, our final witnesses today, if I could ask representatives from Alliance 20, Aruma and Minda, if you'd like to step forward. And thank you again for your patience. I know we are running a bit behind time. I'd now like to welcome representatives from Alliance 20, Aruma and Minda. I understand that information on parliamentary privilege and the protection of witnesses giving evidence to parliamentary committees has been provided to you all. For the Hansard record, could you each state your name and the capacity in which you appear today? If we could start with Dr. Panta.
Hello, I'm Dr. David Panta. I'm the Chief Executive at Minda in South Australia.
Thank you.
Joanne Hewitt, I'm the Chief Executive of Achieve Australia and representing Alliance 20.
Leanne Fretton, the Chief Executive of Sylvanvale, representing Alliance 20.
Martin Laverty, I'm the Chief Executive of Aruma.
Well, thank you all for making time today to be with us. Looking forward to a good discussion. Would anyone like to make an opening statement, a fairly brief opening statement? There's no requirement that you do so.
think perhaps given the time constraints.
More time for us to ask hard questions. Okay. So I'd like to begin by just a general question to you. What is the effect of poor quality and dishonest providers on the broader market? Now, I have actually said this, and I think I need to say it again, that I know that majority of providers are doing a very good job out there in the marketplace, so I certainly want to acknowledge that. But just to say again, what is the effect of poor quality and dishonest providers on the broader market, on participants, on reputable providers, and on public confidence? And what does the sector need to do in order to remove them? Who'd like to begin?
Chair, if I can take the opportunity, and I suspect on behalf of my colleagues, poor quality results in harm to some of the most important citizens in our community. Poor quality undermines trust in the NDIS. It certainly undermines trust in service providers, particularly those not-for-profit mission-based organisations that have been established in many cases by families with adult children today still in the care of the organisations that they've volunteered for decades. The NDIS as it's been established today doesn't reflect many of the aspirations that those families had when they joined Australia. Every Australian counts, to create an environment where their adult children would be safe. As providers, we are deeply concerned to see a refocusing on quality to assure the safety, the well-being of the people for whom we exist. To briefly speak to the matters that Aruma has brought to this inquiry, we see that the well-being, the safety governance of the NDIS is still immature. We see a comparison with the healthcare sector where, admittedly, over decades there's been an opportunity to not just have a single regulator that focuses on enforcement and compliance. The Australian healthcare sector has three different bodies. A complaints ombudsman arrangement in each state that deals with those things that go wrong, with a registration body for health professionals, the Australian Health Practitioners Regulatory Authority. But really importantly, and the proposition we put to this inquiry, is the Australian Commission on Safety and Quality in Healthcare, that is the environment in which continuous learning from both innovation but also those adverse events that occur within healthcare settings is learnt from and translated into better practice. We see the early signs in the NDIS Safeguards and Quality Commission thinking in this direction. We think there is an opportunity for this inquiry to encourage that further step in establishing within our Commission the opportunity for a greater focus on continuous learning from the data they receive and hold, and the frank and fearless discussion with a sector that should not be fearful of sanction about how we apply learnings from the data that the Commission holds. I've raised these thoughts with the Commission, I've raised these thoughts with the Department, and we recognise it will take some time for the Commission itself to mature, and those early signs are encouraging. But Chair, I think I speak on my colleagues at the table today in undertaking to do all we can as not-for-profit mission-based providers to improve quality as we see the scheme mature in the years ahead.
Okay, thank you. I also wanted to just ask a couple of individual questions. So, Alliance 20, on registration and enrolment, Alliance 20 does have a clear position. If you want to just explain what your position is, but also advise the committee on what does a really good practice model for registration and enrolment, what would it look like?
So we support a tiered model of registration, and where providers of high-risk services, and particularly services to people with complex needs, would have the highest level of registration. All of us would be subject to that currently, but provision for lighter touch registration for those more transactional services that are, not, I guess, as risky or as complex. At the moment, we know that a large proportion of the market is unregistered, and so therefore there's no real visibility about incidents that occur, whether that's a safety concern, a health concern, a quality concern, or even fraud, and unless somebody reports it. So the Commission does have oversight, of course, or has ability to step in where complaints are made about a non-registered provider, but they don't have mandatory reporting of those non-registered providers. So it's reliant upon the general public, the participants, or indeed other service providers to make those complaints.
Could the Commission do, what do you think needs to improve in regards to the Commission in order to, I suppose, safeguard our participants and improve the integrity of the scheme?
Well, registration is a key part, and that's not going to be an automatic fix, and I think it's recognised that, yes, not all registered providers at the moment are necessarily operating the way they should, but there are checks and balances, and there is oversight of those providers. So there's mandatory reporting that happens, there's regular audits, the Commission has the right to come in and look at everything we do, the right to penalise us if we don't report matters.
So is it the point that we need more providers registered in the first place?
Yes,
okay.
absolutely.
And I do apologise interrupting you there, but
no, that's okay.
I've just got one more question, and it relates to a rumour, but others might want to make a quick response. So one thing that we've heard today is the fact that participants, on occasion there's errors that they make themselves, or if they're self-managed, they make a good faith error, and it is challenged. From a large provider's perspective, where is that line between a participant or a self-managed plan? How do we actually balance that? Because it's quite, I think it's really quite a challenge when you have someone who's done something as an error, but they've done it in good faith. They haven't, it's not intentional. How do we ensure that they don't end up, we heard a witness earlier, and it's hard to hear these stories. How do we actually, is there a way that we can actually make sure that they're not caught up in these terrible procedures where they're accused of trying to fraud the scheme?
Well, Chair, if I can make three observations. I'm unfamiliar with the specifics of the matter you're referring to. But in general, it raises questions about the efficacy of support coordination. Good support coordination is the advocate for the individual. The second is to recognise that when the NDIS was established, we had really robust advocacy groups on behalf of cohorts of people with disability communities. That's changed. That advocacy voice, systemic, is not what it was in the past, and I think there's a really important opportunity, particularly as we go through this really big transition of assessing the eligibility of hundreds of thousands of people, for a reinvestment in that advocacy voice. And the third observation, I know it to be common, of the three organisations joining me at this table, is that not-for-profits, despite the separation between provider and participant that is necessary to maintain management of conflict of interest, not-for-profits are very often the only advocate for participants in the scheme. And it's in those circumstances that it's providers very often seeking to raise with the agency resolution to the very types of matters that you're referring to. It does not always go well. The system is not designed for the provider to be the advocate.
That's right. So we need to look at the conflicts of interest, is something that you're saying we need to do more on. Thank you. Did anyone want to add to that before I hand over to the Deputy?
If I could please, just again, much of the Minda submission is about the work that we've been doing looking at the actual nature of quality and understanding of what we mean when we talk about quality, because it is key in terms of the reforms that we're talking about, and yet there's still a lot of work to be done to understand what quality means. And quality is very subjective, and so when we've ended up in conversation with some of those individual participants through the self-managed route that have had those issues, it's often been a misunderstanding or a lack of knowledge about what is a good quality input to achieve the particular outcome that they're looking for. And so I think that's also part of the scenario, is how we get a better handle on understanding what quality means.
Thank you. I'll hand over to the Deputy.
Thank you, and thank you all for your time today. My first question is for Alliance 20. You support moving away from the bespoke annual plan towards plans of longer durations. From a fiscal sustainability perspective, how much administrative red tape do you believe can be eliminated by moving towards this more standardised long-term model? And then what are the potential negative impacts, again, noting that a lot of the feedback we've heard is around one-size-fits-all being a part of the problem in the scheme. So how do we balance out that standardisation without trying to put everybody into a box that they don't fit into?
I'm happy to take that. I think Alliance 20 does agree in principle with longer duration plans where people's needs are stable. And I think anything that reduces administrative burden for participants and providers would be welcomed. In order for that to be successful, there must be a mechanism to review plans where needs change. And I note the bill that was released yesterday restricts some of those ability to review plans. So that will be essential when you're talking about plans of lengths of 3 to 5 years. There must be a mechanism of review.
That's right, because things will change during that period.
Yes. And we do have review mechanisms today in the scheme, but I think it would be fair to say that they are lengthy and there are often adverse outcomes, even though there is evidence that needs have changed.
Why do you think that is? And that's sort of a lot of feedback we hear as well, that the whole process is so arduous, it's so onerous, and then a decision is made that is clearly out of line with the information that has been collected, probably at great expense as well.
It's probably a question for the NDIA themselves.
I was just curious. I'm sure, and I will be asking them that, but I have asked them questions like that. I'm just curious whether you have any insight into what's happening there.
I think in previous inquiries we've heard that the planners don't have time to review the detailed and complex plans that are provided. I think the other barrier for providers, we are not invited to the table intentionally, and often we hold information about the people we support that could assist.
Okay. That's interesting, because I have asked questions in estimates around assessments and plans that have not been read, that have cost some $10,000 to $15,000, and participants have had to wait for assessments and then later found out that no one's even ever picked it up to have a look at, and that's egregious in my view, both for the participant and for the taxpayer.
I think that would be common.
Yeah, and I was just about to ask, is that something that you are seeing? Yeah.
Senator, if I can provide an illustration. A cohort of 200 residents in homes in Victoria are previously residents of state government homes in that state. Because of the transition that's occurred in Victoria in recent times of the Victorian government finally ceasing its role in direct resourcing of service provision, Aruma ran an assessment of the residents of that 200 resident group. We provided to the agency evidence of their high intensity needs. That is, their requirement for medication management, catheter management, quite complex medical supports. The agency's data and their determination found that about 25% of those were considered high intensity but funded at standard plans.
Okay.
confirmation that the agency is providing unsafe plans to long-term residents of disability.
They've self-verified that.
In defence of the agency, we have been gradually working through a process to address the needs of those individuals. It should not have occurred in the first place.
Sorry to interrupt you. Did they give you any indication in your discussions with them why that occurred?
Insufficient evidence provided to the agency at the time of assessment. We have subsequently provided evidence of the high intensity need to bring resolution to that. Today it remains an ongoing process of assessment, and this leads me up to the concern I have for the future changes as to how both eligibility and then support needs assessments are going to be undertaken. We have to learn from this experience of ineffective assessments today to make sure as we go through this extraordinary transition we get the system right for the future.
And just one thing for me to understand, how could they have made an assessment that there was a high need but fund at a standard level, but then later go, we didn't fund at the higher level because you didn't provide the evidence? How did they make the initial determination if there wasn't the evidence? Or am I missing something?
There appeared to be relatively straightforward administrative oversight. The evidence was available, the evidence was conclusive, and different decisions were drawn. This is not isolated.
Okay, so that, if I'm reading between the lines, is the evidence was there, but you had to provide the evidence perhaps in a different format and package it differently for them to understand that the evidence actually was there?
We had to make the case that the evidence said what the evidence said.
Oh, okay, all right.
And if I may, at the same time as providers, we're held to account by the Commission around providing certain levels of support, levels of training for our workers for someone who has high intensity support needs. So if somebody is fed by enteral feeding, requires complex bowel care, complex behaviour support, and there's no relationship between what's funded and what the requirements of the Commission are. And when we talk to the Commission, they say we don't have influence over what is put in people's plan and what is funded, and there does need to be coherency, and at least when the Commission's looking into incidents, an ability for them to look at how the funding actually might have contributed to those falling down of quality supports.
How could they not be connected? That's dazzling to me.
The Commission doesn't have any influence over funding at this point in time.
No, but just from the scheme in general, wouldn't you go, well, in order to provide care that is safe and appropriate, you have to provide funding at a level that will provide that safe and appropriate care, not say, oh, but that's not our problem, we're funding here.
And most of the people sitting at this, or all of the people sitting at this table, are actually providing that level of care and qualification, but in our own, through our own balance sheets, really.
That's the impact to Minda that we read about in the report, where organisation of some 128 years, I think it was.
I'll allow my colleague from Minda to
Oh, sorry, I got the wrong one. Aruma, apologies.
If I can address, however, the gap between the price set and the regulatory standards. In healthcare, activity-based funding payments are based on compliance with the safety standards. In disability care, I understand if the Commission had the opportunity to confirm whether or not the price was based on the standard set, there would be a confirmed gap.
Okay.
I was just going to raise the other potential issue in this that we certainly experience at Minda is clearly as providers in that assessment process, we don't have the direct contact with the agency, that is through the family or the guardian. And at Minda, where we've got around about 1,000 participants, over a third actually have no identified family. They are under the public advocate. The public advocate has 32 staff in South Australia for 4,500 South Australians, and they do not know the participants that we're providing a service to, and are entirely dependent upon support coordinators as an interface. And so again, that's just another barrier to getting the right information into the assessment to get the right service outcome for somebody.
Are you needing to rotate, Chair?
Yeah.
Go for it. Yeah.
Okay, over to you, Senator.
Thank you for your time.
Still, John.
Thanks very much, Chair. Thanks for your evidence so far this afternoon. My first question will go to the CEO of Alliance 20. We've heard a lot today about cartel behaviours, where companies only coordinate support in closed shop networks of service provision, basically. How can we change the rules to prevent this?
Thank you for the question, Senator. And just to clarify, CEO of Sylvan Vale, not the Alliance 20 group, we're representatives. I think the scheme should have had a number of guardrails to prevent such cartel behaviour. And unfortunately, for the last 10 plus years, they haven't been there, and it has enabled behaviour of such that you're describing. And I'll give you a couple of examples where I feel that government does have levers and control to prevent some of the examples that I know have been published in the media. And government holds a lot of data. I'll use an example of ASIC. They hold information about companies, who the directors are, ABN data. It's freely available. There is no cross-checking with who is making a claim against the NDIS and whether a company or its directors are in administration, fail to exist. There is no safeguards there, but there is access to data today. And I have examples of where payments have been processed through arrangements like you're describing, cartels, that do plan management, support coordination, direct service delivery, where ABNs are no longer active, where ASIC records show the companies are deregistered. I question how a government that is spending billions of dollars should allow that to happen. And I feel that there is levers there today that can be pulled to control such behaviours. And I think the announcements over the last 2 weeks go a long way to shutting some of the gates that have been unfortunately left ajar.
Thank you for that. Just to be clear, are you proposing a strengthening of ASIC to play that role, or of the ACCC, or where do you see that lever?
I see it as a sharing of data, Senator, where records between the ATO, Centrelink, the NDIA, ASIC, any government department that holds information about providers and people that will prevent fraud should be utilised.
Yeah, okay, thank you. Now, we've also heard reports of behaviour such as support workers clocking in using an app 5 to 10 minutes before their shift is actually due to begin, then charging the NDIA for that additional 5 to 10 minute window that they actually haven't worked within. Now, while that isn't a great expense for the person on their particular day, once you add it up across the course of a week, a month, a year, it does add up, and it has a big impact on many participants. It's also a process really that at scale is able to be worth millions of dollars to providers engaging in those practices. What protections do you have in your service provider against that type of fraudulent practice?
I can talk. Would you like to take that, Joe?
Well,
I can talk Sylvan Vale's perspective. In our organisation, we do use an app, and one of the safeguards around that, where we provide centre-based services, is that we run geolocation tracking over the top of that app. So it shows if you logged in on time but 2 kilometres down the road,
Mm-hmm.
or you logged in 10 minutes late or early, as the case may be, it will pick up where that clock occurred. And we have found that very effective in ensuring that our staff are on site where they're supposed to be for the duration that they should be.
Okay, so just clarifying though, if I'm a support worker and I'm clocking in, and I am geolocated at the participant's home, but I'm actually sitting in the car in the driveway, how does your app differentiate between that?
It wouldn't of such a close location.
Yeah.
We are reliant on feedback from our participants.
And having that regular check-ins with participants is really critical. So making sure that there are supervisors who are checking in with the participant. There's an audit team within the organisation, and many large not-for-profits certainly have that, that actually interview participants and ensure that people are turning up on time.
Yeah, but you, all of the service providers that are appearing here today, the majority of your work is either agency managed or plan managed. Yeah? And that's the same for Aruma? Yeah. So when you put a bill through with an agency managed provider, as the head of the quality and at the head of the fraud fusion task force told us at the first hearing we had, there's not actually a check process. You just kind of put it through currently. So that 5 to 10 minute window that could be being claimed just goes through and comes off somebody's plan.
So for some of our organisations, the staff clocking information links to billing.
Yes, it does.
Yes, so there is a safeguard there that we don't overbill for the 10 minutes for whatever the period of time.
Right. So for some of them, but not for all of them.
I can't vouch for what all providers do.
No. But for your provider, you have that.
Absolutely.
Is that the same for all of you?
Yes.
Absolutely.
Now, in terms of the recent announcements by the government, and I'll put this to each of you in turn. We had on the 22nd of April 2026, we had a lunchtime announcement from the Minister of significant changes to the NDIS. Did any of you or your organisations receive any communications from the Minister's office or the government, or have any awareness of the changes that would be announced before lunchtime on the 22nd of April? And I'll start with you, Doctor.
No, not at all.
No?
No.
No.
Yourself? No?
No.
No?
No.
No. Okay. So you were in no way briefed ahead of that announcement as to what would be announced?
No.
Okay. Could you provide to me then, on notice, each of your organisation's anti-fraud frameworks and a copy of your internal anti-fraud controls? Yep. Hansard, sorry, doesn't get nods. We'll just get yes?
Yes.
Yes.
Yep. Excellent.
Yes.
Wouldn't want to leave any lack of clarity there. In terms of the amount of money that your organisations turn over, how many, well, first of all, let's go participant coverage. How many participants do each of you service?
So Minda is approximately 1,000 participants.
1,000?
600?
600.
450.
5,500.
Right, okay. And of the cohorts that Aruma manages, what's your breakdown in terms of agency managed or plan managed?
Would have to provide that very happily on notice.
Happily on notice, okay. Would that be the same for all of you, or have you got that information here? Okay, great. And what is the amount received by your entities from the agency in the last financial year? How much money did you take in? Can you give us some idea?
NDIS payments totaled about 380 million.
380 million.
Around 70 million.
Yep.
125 million?
Yep.
Around about the 140, 145 million.
Okay, so by far and away by those metrics, and meaning no disrespect to any of you, but in terms of presence in the market, number of participants and dollars taken in, Aruma, out of the four of you here, you're the largest.
Yes.
in terms of those metrics. So within your organisation, are you able to tell the committee today that you are 100% confident in your anti-fraud measures, your internal fraud controls? Is fraud at a zero in a room?
Fraud is not at a zero, but what it is one of our three priorities in this order. First, the safety and well-being of our residents, our participants. Second, the worker safety of all of our staff. And third, the financial fidelity of how we protect taxpayer and participants' funds. And we apply the same protections in all three areas. Not only do we seek compliance, and in recent years have demonstrated compliance with the multi-regulators to who we are accountable, we seek to exceed those bare minimum expectations. In relation to fraud, we do have a considered fraud plan. It is reviewed in practice on a monthly basis. Where there are any incidents that may indicate fraud, they are provided to the Commission. But further to that, we have our own investigations team that tests the validity of any allegation. Where there have been instances, and there is one that I'm going to speak to specifically, it was investigated, it was referred to the police, and a criminal conviction was ultimately confirmed. The importance of these processes is that with human services, the reality is that there will be incidents that relate to participant well-being. There will be incidents that relate to worker safety, just as there will be incidents that relate to financial misuse of funds. The importance is to ensure that there are both the systems and the comfort of organisations to monitor those systems and be very transparent about it. There's a really important principle as well, because I agree with the premise of the question that you've put to us as providers today and providers earlier. There is a criminal business model that has been established by some within the NDIS. Some of those we see them publicly prosecuted and held to account. There's then also mostly a group of not-for-profit providers who find abhorrent the types of headlines that we see when these frauds come to public attention. And it's those organisations, of which mine is one, that have these systems that want to work not just with this inquiry on what might be improved, but with the Commission, with the agency, with the department, to make sure that in years ahead we don't talk about fraud. Because today, to work in the NDIS is to be seen through that perception of the public narrative that it's all fraud. And we all know that it's not.
We are going to have to move on because we're coming to the end of time, and Miss Berry has once again been waiting patiently. So, and thank you for doing so. Over to you, Miss Berry.
Thank you so much. Hopefully you can see and hear me.
We can see you and we can hear you.
Fantastic. Thank you very much. Thank you for all three of you for your excellent submissions. Just in the interest of time, given technically we've got about 3 minutes or 2 minutes to go, I wanted to focus my questions
with our presenters, Ms. Berry. We will give you a little more time because you have been waiting patiently.
Thank you, but I will try and keep it fairly tight. So my questions really do focus on the submission from Aruma. You've made some really interesting observations in your submission. Particularly, you talk about targeting enforcement responses to the locus of risk rather than defaulting to organisation-wide sanctions where non-compliance is localised. And you in your submission talk about effective regulation or mature regulation. So I wondered if you could just speak to that point.
In large human service organisations, the reality, particularly with a dispersed staff, is that from time to time there are going to be occurrences that warrant investigation and the interest of the regulator. Now, does an isolated event mean that an entire organisation working across multiple sites is to be subject to the type of enforcement action that could actually see that organisation have to disrupt services to thousands of people. In the healthcare system, there is a principle of just care where the acknowledgement of failure, the learning of the lessons and the application of change is part of the way in which medicine has been practiced for generations. We're not yet at that stage where within the disability sector there is confidence to admit the errors that occur, to correct them, to learn from them, and have a place within our regulatory framework that actually promotes continuous improvement above and beyond regulatory compliance. That's why I'm suggesting to this inquiry that looking to the Australian Commission on Safety and Quality in Healthcare as a model for the disability sector in years ahead, to sit inside or adjacent to the NDIS Safeguards Commission, would give the opportunity for the learnings as organisations and the regulator builds better knowledge about good practice is something that is missing from our regulatory architecture. This inquiry is in a position to recommend that for future policy development.
Sorry, I keep disappearing off the screen, I think. Just wanted to also, so the Commission is about to, over the coming years, have a fairly significant challenge as we expand the number of providers and types of supports that are registered. And I'm really interested to hear from yourself, given that your submission sort of speaks to effective regulation. You talk about graduation. So you say in your submission, integrity measures should therefore be applied in stages within a graduated framework that distinguishes between remediable system failures and conduct that is reckless, exploitative, or persistent. Now, at the moment, we've got a system whereby 6% of providers are registered and they are regulated in a fairly intensive kind of a way, I would think. And therefore, we're going to need to bring all of these other services into that regulatory system. Is the current system of regulation working reasonably well from your perspective when it comes to graduation? And the way that reckless conduct is distinguished from, failures which need education, system reform, etc. And how well do you think we're positioned in order to roll out registration and regulation across other parts of the scheme? That's a fairly big question on a Friday afternoon. Thank you for your thoughts.
So Aruma's direct experience with the Commission today is that they are expert in handling the more significant matters that warrant their attention and bringing them to the appropriate conclusion. In the future, I suspect they don't have the capacity to deal with the scale of what's ahead of us, and therefore looking to the learnings of adjacent sectors. The healthcare sector in its three-armed regulator is a model for the disability sector to look to for the years ahead. And if you think about what the Productivity Commission originally proposed for the regulatory development of our sector, we are exactly where we'd expect to be 10 to 15 years in. The regulator in itself is still in its infancy, and its next iteration is to consider what is the way in which its preventive function can be informed by data use, data sharing, and continuous learning promotion, but then also refining its interaction with providers to ensure the confidence for disclosure of those near misses, of those incidents that warrant reporting, but then targeting their efforts for the egregious harms that will always necessitate a significant penalty regime. The architecture is there, it is not fully complete, and this inquiry has the opportunity to urge further policy development to ensure that we can have an enforcement arm, we can have a preventive focus, but also to build what's going to be necessary for the professionalisation of our disability support workforce, very similar to that which exists in both aged care and healthcare.
Thank you. Thank you, Chair.
Well, that was an interesting note to end on there. I would like to thank you all for your really constructive and thoughtful responses to questions today. So we're about to conclude the committee's hearing, but before we do so, there has been a few questions that have been requiring responses. If you could please provide that information to the Secretariat by Friday 29th of May, and if you do need further time, please liaise with the Secretariat. I would, before finishing, like to acknowledge the role of Hansard and broadcasting today. Thank you for your work. We don't notice you greatly there, and but you do your job and you do it well. So thank you very much. To the Secretariat, who always do a great job, thank you for being with us and supporting us today. And importantly, to members of the committee who do a great job, have put time in to ask pertinent questions, and on behalf of the committee, I thank you all. And thank you for your attendance. And we will now adjourn the committee at 4:51. Thank you.